Hi everyone, welcome to another episode of Inside Out with Saumya. Today I'm very excited, and I guess both me and the guest speaker are sort of nervous as well to talk about this topic, but also very, very excited at the same time. So, the topic that we're going to talk today is quite interesting. We'll be talking about a second brain, which is the gut, from the lens of one of the most ancient Indian sciences of Ayurveda. We'll be discussing the relationship between our gut and mental health, understanding how does the brain and gut communicate to influence each other. The common signs that indicate imbalance, especially in conditions like depression, anxiety, and insomnia. And of course, in the end, some actionable tips that we can utilize to keep ourselves healthy. This is a very interesting conversation, will be a very interesting conversation. And I'm very passionate about both mental health and Ayurveda. So I am the one who's most looking forward to it. And for this, the guest speaker that I have today is Dr. Aiswarya Santhosh. She is an Ayurvedic doctor practicing as a junior doctor in Puthotum Ayurveda Hospital in Kerala. She simultaneously runs a private practice taking online and offline consultations, wherein I too consult with her, by the way. Also, guys, she has an amazing Instagram channel called Ayurvedic Healing, where she shares bite-sized informational content on Ayurveda. Anyone who wants to give her a follow, just go ahead, type in that handle name, and just start looking at the videos. You'll already learn so much from her. So that is a very mini introduction. I know she's much more than that, but for now, I welcome you here today, Aishwarya. Hi, how are you?
Hi, Saumya. I'm good. How are you?
I'm doing very, very good. I can see both of us feeling slightly jittery and nervous. And okay, how will
Yeah.
this conversation go? But yeah, how about without focusing on the content that we're going to cover today, we just talk about you as a person and, this introduction around who you are that you'd like to tell our viewers.
Okay, so who am I? That's a very big question.
Oh, yeah,
I can
I
only
realize.
answer with my name. So I completed my Ayurvedic degree, that is BAMS, from Ahilya Ayurveda College in Kerala. And then I transferred my college and did 1 year internship in another very traditional Ayurvedic college in Kerala. That's known as Ashtanka. Then I
Mm-hmm.
was like working here and there, learning from very old Vaidyas to learn more about Ayurveda. It's more than what's in the text. We need one guru to learn from, right? So
Uh-huh.
still learning that Ayurveda, that basic part here and there from many old Vaidyas, still learning.
Lifelong learning it is for sure.
Yeah, so we say Ayurveda is like a big ocean, and what we know is a drop. So there is
Uh-huh.
so much left in there. One lifetime is not enough to learn the
Yeah.
whole Ayurveda.
Which also speaks about your humility as a person, Ashwarya. I've met a lot of people who claim that I am the one, I know everything. But the fact that you said you know just a drop in the ocean says a lot about you as a person.
Thank you so much. I'm still learning under Vaidya Brahmadattan. He's a
Uh-huh.
very ancient Ayurvedic practitioner. He have been practicing like he's the fifth generation Ayurvedic practitioner.
Yes. So you say you started in a traditional college. Is there any difference in Ayurveda as well? Traditional, modern practice.
Yes.
Yeah.
So nowadays, what we learn in Ayurvedic college is like a syllabus based.
Mm-hmm.
There's a lot to learn, but we have to compress that to like a 5.5 years course, right?
Yeah.
So they have compressed a lot, and in each year we have whatever people study MBBS, we have the same textbook of that and the Ayurvedic thing. So for the sort of exam thing, we have to learn everything like that. It will be like a grasping kind of thing. And we know the basic, but a traditional Ayurvedic college is very different. It's like how the olden people were learning. The
Uh-huh.
one guru or Vaidya will talk about it, and from what he talk and we listen to that, everything we learn like a Gurukula practice. It's not like a 9 to 5
Mhm.
college hours, but we will be there with them for all the time, making medicines,
Oh,
doing the
wow.
practices.
Yeah.
That's how a Gurukula system works. And also, it's not just a healing science. Our character also change a lot in Gurukula
Mhm.
setup. So, like the social codes, all those things will be learning from a Gurukula college than from like a normal Ayurvedic college. The college that I studied to complete my BAMS was like a normal Ayurvedic
Yeah.
medical college,
Curriculum based. Yeah.
like a curriculum based. And then I've moved to another college for my
Mhm.
house agency, where this practice were there, where like we wake up early in the morning. The class starts by like 6:30ish, and we will be learning all the Ayurvedic slogans. So we have like a written sloga. It's not in
Mhm.
English that Ayurveda is mentioned. It's in Sanskrit verses.
Yeah. Yeah.
Everything is verse. So we will be reading it all round, and then we go to the OPs and work with the doctors. And
Oh,
sometimes here
wonderful.
and there, where we have time, some Vaidyas will come and they will talk about their experiences. They will teach the basics of Ayurveda.
Hmm.
As it was like a 1 year thing, it was like a very short period time for me. After house agency, I had to move out, right? So
Uh-huh.
I found like other Vaidyas, like traditional Vaidyas, where they will sit and talk to you for hours, so
Mm-hmm.
that here and there we will get new informations, like
Ah,
new
yeah.
insights than
Of course,
we
of
already know.
course. Is this the class that you have been like whenever
Yes,
you consult, you say that, okay, I have a class
yes,
in the evening?
yes, I'm in
Oh,
the class.
amazing.
So that starts from 11 o'clock, 11:30ish. Where he also have OP. So after that OP time, we'll sit there, we will talk about everything. Sometimes we even take some chapters and again go with the verse. The thing with Sanskrit verses is that it's not just one meaning to that. If you look deeper and deeper, there will be a lot of many other meanings to those verses. So we will learn whatever is possible in between. If patients come, we will see them and we do
Wow.
the treatment. Sometimes we do vasti also in between. We will
Uh-huh.
prepare our medicine and do the vasti. Vasti is like a medicated enema.
Yeah.
So to those who don't know much, so it's like
Yeah.
a medicated enema. We do that in between, and maybe like some small practices like oil massage and kiri, like a poultice treatment. It
Mm-hmm.
everything goes in between, and then again when we get time, we will learn again. We also share our information. What we know, he will
Yeah.
also ask, and he will make sure like everything is right, and he also sometimes learns some things from us, so it's like that.
Wow.
And he's
Truly,
a great idea, as this is
yeah,
like a fifth generation.
of course. There's so much
Those
inherited
generational,
wisdom.
yes, generational knowledge, like what
Yes.
he learned from his grandfather,
Yeah.
so he learned from his father, like that. So whatever that traditional thing, he passes on and on. And from that, what we have right now to this
Yeah.
generation by year, we also learn. But I don't have an Ayurvedic background, so these people have more solid knowledge than what we
Yeah.
just learned from our college.
I've always been curious how it must be like to grow in a family of Ayurvedic doctors, practitioners. From the moment you take birth,
Yes.
you're raised with those values because
Yes.
Ayurveda goes way beyond just the medications or
Yeah.
treating. It's a lifestyle, right?
It's a lifestyle and a lot more.
Mm-hmm.
So the word Ayurveda means it has two. If we break the word Ayurveda, it's Ayur and Veda. Ayur means life,
Mm-hmm.
okay, and the Veda means science or knowledge. So it's a knowledge of life. It has all the aspect, like
Uh-huh.
maintaining
Yeah.
our health, curing the person who is diseased, and also Satvata. That's like a very basic part. It mentions about the codes of conduct, like
Okay.
what you should do, what should you should not do,
Mm-hmm.
how to live, how to talk, and all
Wow.
those things that help us to lead a happy and healthy life. So
Yeah.
that also comes a part in the mental health part, like. how
Indeed.
we take these things, how we should respond to some things. Like there are a lot. It's like a very big topic.
Yeah, indeed, the science of life. Then I had somewhere read it's the science of aging because Ayu means age and Veda. So
Ayur, Ayur.
that's what I might be mistaken here.
No. I'm like, okay, this is how the our teaching works. Okay, so we say what we know, and the guru will usually correct. He usually
So we're
corrects me.
also having
It's
that
not Ayu,
guru.
it's Ayur. You should say that, otherwise it's wrong. He'll be like that on my face. So I think that is also coming to me. So when you said that, my mind directly went to like, it's not I, you have to say Ayur.
Yeah, so you are now teaching me like your own guru. Like it's not Ayu, it's Ayurveda. And I really appreciate that because these are the things that I've picked up maybe from social media, some books that I
Yeah,
have gotten. But you're someone who actually has been in this relationship with Ayurveda since maybe a decade or so. So you will
yeah.
definitely know much more. And
A
no
little
pressure to say that, okay, you need to know everything.
bit. No, still every Ayurveda doctors will be like that. I
Yeah.
think if you talk to any doctor, he'll be saying that I don't know much about Ayurveda. There is a lot more to study.
Yeah, indeed, I'm thinking about the overlap between mental health and Ayurveda also because even the ethical mental health practitioners that you meet, they will also have the same stance that we don't know. Even though we might be practicing for years, reading, we're like, no, there is so much more, and every client opens up a new chapter, new areas of
Mhm.
learning, new research is coming up. So that stance is the same that we don't know. We do know, but we don't know.
Yeah, we don't know, like something is there, but we don't know what that something is.
Yeah, exactly, exactly. And as we're on the topic of this, I want to ask you. So today we're talking about the gut and the relationship between the gut and mental health. Why do you think it's important to look at that relationship from the lens of Ayurveda when we do have modern science which has evolved, modern medical science that has evolved so much?
Okay, so how modern people looks us
Mhm.
is very different from Ayurveda. So Ayurveda is like a very age-old practice. There was not this much of what surgical interventions or uh, any modern technologies was not there, taking X-rays or scans. But still, if you look to those texts and verses, as we know this modern thing also in our mind, as like a new generation Ayurvedic doctor, if
Mhm.
we mix both, we will see without these technologies and without these what we say, all these scans, x-rays and lab tests, they have beautifully written about everything. Whatever new disease, it's not new according to Ayurveda.
Yeah,
So in
it's
Ayurveda,
all
there
in
is
the
a verse
text.
that says you don't need to name a disease to treat it.
Okay.
You
Okay.
don't need to name so Ayurveda, even though it's like a age old, it hasn't complete. If you look to depression, there is no single word that you can correlate.
Yeah.
So that was not much there on their times as depression. So it's like a very different thing. Our lifestyle, our habit, our mental thoughts all have changed. So that
Yeah.
some changes will be there here and there. But
Mhm.
still, if we read those whole texts, we will see here and there what caused her or his depression or anxiety. And
Mhm.
so we have to learn that text, and only we will be able to know that. I think you will see from my face itself. So in some diseases, as part of their physical symptoms, they will also be giving some mental symptoms also here
Yeah.
and there,
Of course,
like
the body and mind are connected. It's
a
often
lot
even in my
connected.
practice, yeah, when the clients come in, of course, I am not a medical professional, so I won't ask them the specific bodily questions. But if I tend to ask them, okay, how's your sleep? Or, how has your gut been? How has your digestion been? All of those things, they will report imbalances there.
Yes, especially in their gut. So everybody, so if you I think in our consultation you may have noticed, every time we get on a call, I'll be asking you how your appetite, how your bowel movement is. Do you have
Yes.
bloating or gas related issues?
Yes.
And how's the sleep? These are the three or four things that I've mostly asked. But if I ask you how hunger is, most people say yes, because they think they're getting the hunger, they're digesting the food. But if we like ask a few more questions, we will know they won't be having good appetite. They have been something, but it won't be proper.
Right.
Either if they have the bloating, all those issues, if you have gas accumulation, then your appetite is not proper. Your appetite won't be like in its optimum level if you have all these issues. If your bowel
Right.
movement is not proper, it's all connected. So if gut is any of this symptom is there in a person, you would have noticed, like in your patients more, you've talked to more mental health people than I am. So if you look deeper, they will have any of.
Got it. Yeah. And even in mental health, this is a relatively new conversation that is opening up recently about the gut and its impact and its relationship with mental health. I remember when I was studying back in my master's or undergrad, there was no conversation about it. We were not even taught that you need to ask these questions. Even now, it isn't natural in my practice to ask this. I have to consciously remind myself to check in with some clients, okay, how is your the physical, the anatomical aspects of it. But I don't know in my personal journey of mental health issues as well that how big a relevance there is and how much we can improve either of those by tapping into one.
Yes.
So even in modern science, there are psychiatrists that are here talking about this connection as well, but not a lot of people. And what I'm wary of in modern science is the pills that come with it, which have a lot of side effects, and the curative part of it. But in Ayurveda, I noticed there are a lot of balancing aspects that, okay, there are, of course, medication with lesser or no side effects at all because they're herbs, they're naturally found. And you may correct me on that if there is any.
Yeah. Whatever has some effect, they will have some side effect. Like if there is
Yeah.
an effect, there will be a side effect also.
Uh-huh.
But 90% of the time, if we look to a person's prakriti or their body constitution, how their digestion is, vikriti. Vikriti is how the doshas are. We say three doshas in Ayurveda. That's the base of everything. So if doshas are in balance, that's prakriti. And if it's imbalanced, it lead to diseases. So what that imbalance is, also what your prakriti is, what your body's natural constitution is, and how doshas have changed from that constitution. If you are like misinterpreting those things, it can lead to side effects. And if you take overdose of certain herbs also, but still, like most
Yeah.
of the side effects are due to the first reason. Like
Yeah. With a
that.
lot of people putting out a lot of information on the internet, sometimes we tend to self-medicate even within Ayurvedic
Yes.
medication, which is not healthy.
So in a disease pack aspect, there are so many things like chaya, prakopa, like that. So
Okay, okay,
first,
okay. Let's
I
go back to the basics. Okay, let's go to assuming that the people who are listening to this do not have a background in Ayurveda. Can you introduce it to them very in simple terms, in brief? That will be a task. Now that is a challenge for you.
that's a very big challenge.
Yeah.
Okay. So in Ayurveda, I think you all know how everything is made in this universe is of five things. That's water, earth, like that five elements is made in everything, the plants, our human beings, everything is because of Panchamahabhuta. We say Prithvi, Agni, Vayu, Akasha, all those things. So if we correlate to an modern terms, we can say water, air, space, like that, and fire, all those things is causing one's body. So that's we say like if you have Akasha and Vayu, that's space, we can roughly say Akasha as space, and air element, that's Vata. If we go to Pitta, it's more fire. It's more fire, and a little bit of water element is there. Without water, it's not just the fire that's Pitta. I think most people misinterpret that also. It's just fire that's Pitta. But there is a slight bit of water energy along with it. And then if we look to the Kapha, it's more Prithvi and Jala. That is earth and water. So if we look to a Vata person or like Vata Prakriti person, he will be always moving. That air element thing will be there. He will be shaking his legs. The same thing
Okay, if
happens.
I am understanding correct, what you're saying is we are made of, all of us are made up of
Yes,
those five basic
5 elements.
earth, fire, water, air, and space. All of us have those elements in us. But
Yes,
to what extent, like two of these elements or one of these elements will dominate a
or 3.
person, or three will dominate a person, which come together to form the doshas or the constitution of
Prakriti.
prakriti of each individual being. And you have said there are three doshas, right?
Yes, Vata, Pitta, and Kapha.
Three doshas are Vata, Pitta, and Kapha. Vata is a predominance of air and space. Pitta
Yes.
is more fire along
Fire.
with water.
Water.
Yeah, and Kapha is earth and water.
Yes.
And these, when we can understand these aspects, it also represents in a person's physical, mental, spiritual aspects of life.
Everything. Yes. So
Okay.
that's what I'm giving you an example. So if you
Yeah.
look to an, let's say it's easy to talk about Kapha. So a Kapha person will already be a little bit fat. Okay. They will have a little bit more bulk in their body. So that's like if you look to Prithvi and water, it's more heavy, right? Than the space and air. It's more light. So that Kapha person will already be heavy because they have more water and earth element in them. And they will always be sitting. They won't like to work because that heaviness is there. And their mind will always be clouded. They won't be able to take a decision very fastly. They will take their time slowly. They
Like
will
slow
take
and
it.
lazy. I
Yes.
don't know how to use the word lazy, but
Yes, you can say lazy. If Kapha person is a little lazy. And if we look to the depression, it's the same thing that Kapha is more there in depression. So if you look to a person who have depression, they have more Kapha in them. That is earth and water element if we go deeper. So they will always like to sit somewhere. They won't have energy to do anything. Their mind will be clouded. They won't be able to what concentrate much. All those things, that heaviness will always be there. That's how depression is. And they will be like to lie down all the day. They won't like to do anything. All that heavy part is there in depression
like
and
hypersomnia as well, sleeping a
a
lot,
hypersomnia. And if we look
lack
to
of
the
motivation.
Kapha, yes, if you look to the Kapha increased symptoms, it has mentioned Adinidra in it. That is, they will
Atinidra.
always feel sleeping. They will always feel sleepy also. It's not just they will be sleeping all the time. You will feel that sleeping,
Drowsy.
drowsy, like you want to sit somewhere, you don't have energy to do anything. All those are Kapha increase symptoms. And if you look to anxiety, it's more energy, right? They have palpitation, they will always be moving their hands and they will be shaking their legs. It's more air, it's always moving. Heart also, it's moving more, like that palpitation. And if you look to a person with depression, generally it depends on person and
Of
their
course.
vitiation. It can be Kapha and Vata also, say they will have mixed symptoms. So if we look to just a Kapha increase for depression, we can say they will always have that heaviness of the chest, like some stone is sitting.
This is kapha depression you're talking about.
Yes, kapha, like that heaviness. And if you look to a vata predominant, like anxiety, it's more palpitate, like heartbeat is more you're sweating, you're always moving, your mind is also having a lot of thoughts,
Restlessness,
restlessness,
fears. Yeah.
fear. Fear is a little different, but still, like that restlessness, all those moving things is because of vata. So if we
Yeah.
look to a
No, I
anxiety,
see what you're saying. Most of my clients who complain about their anxiety and are concerned, the one thing that they expect from therapy is just like make me stop. Like I want to ground myself because I feel like it's constantly going. So that is movement. That's
yes,
constant movement, not being able to anchor.
yes, there won't be anger down to one thing. That's grounding won't be there. Because I think Kapha is the opposite of Vata. Their qualities is different. One
Mm.
is unctus, one is dry. So it's different, opposite, completely opposite, Vata and Kapha. So for an anxious person to have that, to feel grounded, they have to reduce that space and air element and increase a little bit of that earth and water element, so they will feel more grounded, and this what stopping those thoughts and restlessness will happen normally.
Yeah, and while we're having this conversation, the disclaimer that I want to put out there is we are talking about these conditions from the lens of Ayurveda, and this is not to invalidate any other science, their outlook, or any person's individual experience. If this helps you, great. So, take what you want and drop what you don't need. This is
Yes.
with all due respect to individuals who are suffering, who are struggling with it. Maybe this helps you, or maybe it doesn't. It's not at all to invalidate your experience.
So everything is different. So what I look the world through is based on my knowledge. Okay,
Yes, of
that
course.
not might not be the same for you. So the
Mm.
same thing goes with different sciences. But I'm an Ayurvedic person. I look through what I know. So everything I find, every symptoms I correlate with Ayurvedic science.
Yes.
Same goes with the homeo person, yoga person, allopathic person, like modern medicine. What
Yeah.
they learned, they are like seeing in the patients.
Yeah.
So
Well said. Well said.
it's not the
Agree.
same. Like it's different. It depends on what we know.
Absolutely. Yeah. And with that, please continue. You were talking about anxiety, vata.
Yes, anxiety is more like that. And if you look to insomnia, it's more pitta and vata. So kaba
Okay.
help us to feel grounded, right? So kaba help us to sleep. That same
Mm.
goes to adinidra, it help us to sleep. The opposite is pitta and vata. Vata is always moving. So that when you go to the bed and have restless thoughts in the mind, all those things are related to vata.
Mm-hmm.
And if you look to the symptoms of increased vata and pitta, there is alpanidrata in it. That
Say
is,
that
you won't
again.
be alpanidrata. That is, you
Okay.
won't be able to sleep properly. The sleep,
Mm-hmm.
either the quality will be less or the duration that you're sleeping will be less. So for
Mm-hmm.
a vata kind of insomnia, they take time to fall asleep, but they wake up in between. Like
Mm-hmm.
they get up in between for some time, then they won't be able to fall asleep, then they again fall asleep, and then they wake up again, like that goes. And if you look to a pitta person, he will fall asleep, but after a certain period of time, within few hours, he will wake up, and then he won't get a sleep, then
Okay.
he'll
So
be
with
like,
vata insomnia, there will be fragments in between, but they'll
yes,
be waking up, sleeping. But for pitta, they will wake up and they won't be able to go back to a sleep.
go back to sleep. So they will
Ah.
be able to take like a depends on the person and how much vitiation is this. We can roughly say maybe like till 2 o'clock or 1 o'clock they will be able to fall asleep. And
Mm-hmm.
then after that they wake up and then they won't get any sleep. Maybe till 3 o'clock.
Yeah.
It depends
Yeah.
on the vitiation. So
Yeah.
that's how like a pitta increased, not insomnia, how increased pitta affects our sleep. We can't say
Yeah.
insomnia.
And
And
of
vata,
course, I appreciate you bringing that one statement because it's not always about the increase or the aggravation leading to a disorder like
yes.
depression, anxiety. It can just start causing imbalances and can or cannot go to the extent of a disorder.
Mhm, mhm.
Yeah.
So in Ayurveda, we say like there are 5 stages of a disease.
Yeah.
First,
So
like
one second, 1 second. I want to rewind a little. You
sure, sure.
described kapha as a person, right?
Mhm.
How they might be a little sluggish, heavy. They would want to sit and not do very strenuous activity, maybe,
Yes, they will
right?
be like very lazy, lethargic,
Lazy. Yeah. So similarly,
introverted.
okay, so introverted can also be one of the
Yes,
factors.
they won't have that, like they won't feel like they will like to sit somewhere. So if you go to a party, if you see someone sitting in the corner without interacting much to people, we can say either there is a kapha imbalance or that his prakriti, one of his prakriti might be kapha. Okay. One of the prakriti. But there are also, if the digestion is proper, that also can lead to this like sluggishness, lethargic things. So we have to go deeper. But still, if a person is sitting there, not want to interact with anybody, oh, I'm fine here, I don't want anything, let me sit, that
Yeah.
means the kapha is a little more in him, or his
Uh-huh.
prakriti is kapha.
So the good part that I'm seeing in a kapha person is also they're very self-assured and sorted. Like, I don't need anyone. I'm okay by myself.
Yes, I'm good. I can manage myself. No issues. I don't need like they will be like a strong person. We say
And
Kava
very
Prakriti is the best
patient.
Prakriti. Yes, very patient. Oh, if you look to a Vata person, he will be like very impatient. Like they won't have the energy
Right
to listen
here.
to anything.
Right here. Like, quickly,
They
quick.
won't have. Yeah, we have to change quickly. I can't listen to the same music for a long period of
Oh my
time.
God,
Can't.
boredom is a real thing for Vata. For the viewers, I relate a lot with being Vata. And Aishwarya has also told me that I do have a lot of Vata inside me. And I notice boredom. I get bored like this in a snap
Yeah.
of a finger. Be it sometimes people also, conversations, activities. I need to constantly shift change. I will be quite impatient, jittery in new situations, a lot of heart palpitations or sweating. All of those things will go on. So
Yeah.
I have just started describing Vata. Please, you take over from me.
The same goes in the relationship also, it goes. So if you look to my husband, he's very grounded. He's that typical kabha person and a little bit of pitta, but he'll be grounded. He don't want to try any new things. He's happy sitting at home
Yeah.
with his work, like whatever work he's doing, he's fine with that. Like he don't want to like improvise what's new next. But for a vata person like me, like I have a vata energy in me, so I'll be like, okay, I want to try new things. I
What
have
next?
what next? I
Yeah.
want to go somewhere. Like it's always change for me.
Yeah.
And also there is a fire in me that also causes like very fast changes. Like, okay, I'm easily gets angry. He rarely gets angry. That groundness is there in him and change in me, like it's opposite
Yeah.
us, so that also can cause problems in relationships.
I am looking at some parts and reflecting in my personal relationships. And I'm also noticing, like with Kapha, we spoke about how they can be self-assured and, very chill, laid back, that, okay, whatever is going is going. We don't need to constantly do the next thing. We can literally
Yeah,
soak in this view, sit at a place, be mindful. With Vata, while there is a lot of movement, I also see it comes with a lot of creativity or
yeah,
desire to invent, innovate,
that
think out of the
desire
box.
also is a part of pitta.
Okay.
Pitta is
Okay.
fire, right? Like vata is always moving, so along
Uh-huh.
with that pitta we'll be like, okay, new things, next
Yeah.
thing. That energy or passion we say, right? That's more
That fire, we literally say
fire.
fire. Yeah.
That on fire thing is like a pitta. Like you would have noticed that also.
Uh-huh. I am trying to think of a few people. My mother seems to be a little pitta, and it's
Yes.
been so. Aishwarya has also taken consultation with my mother, so she's like, yes, she is
Yes, she'll be like
definitely.
next. Okay, shall I try this? Shall I try that medicine?
And
This
even
new supplement.
learning, very much like she's inclined towards, okay, I have she's now learning acupressure, and different spiritual things. Okay, we can do this. Oh, I want to eat this, I want to try that. So that fire
Yes,
is very much, that passion is alive.
yes. After that, she will want like, okay, this is fine, this is good. What's
Yeah,
next?
I'm done. Done and dusted with the
And
last thing.
what's next?
What's
Oh,
next?
and Pitta person, if you look to them, if you give one task to a Pitta person, they will be like very pakka on it. They have
Okay.
to do it properly. They have to do it like pakka with
Hmm.
time. That is like a good sign of Pitta.
Oh, so
And
punctuality, discipline.
yeah, discipline. Discipline is a little bit of kapas, like
Okay.
grounded, but that getting everything done, that fire to complete it properly,
Hmm. Would you
and
call it perfectionism?
yes, a kind of perfectionism. But that
I see. I will
I
tell that
can
to my
have.
mother.
She's like that.
A little, yes. If she wants to do something, she would like to do it perfectly.
Very perfectly. And they will have that fire at every point. Like, I have to get this done like this way, and I have to get this done like this. And
Yeah.
if something is changed, they will get irritated and angry.
Yeah, even when she sleeps, so she does sleep well, but even a slight change in if it starts raining, so there's a change in the weather, right? She'll wake up,
Mhm.
she'll know, okay, okay, something is happening. Or if I am with my friends and we're making a little noise, so my father is relatively a kapha person, he'll sleep through it. But my
Yeah,
mother will know, okay, okay, abhi ye shor macha rahe hain.
that's a Kaba person. He'll be like, okay, it's raining. It's
Sleeping
outside.
all the
Let me
time,
sleep.
unaffected, unaffected. Yeah, now that you're talking about it, I'm noticing how so I'm a single child, so it's just my mother, father, and I. All
Hmm.
three of us have different sort of doshas more present. I am more vata, my mother is more pitta, my father is more kapha. We're a
Yeah.
whole package.
So it will be like different for all three of you.
Yeah.
Everything will be different.
It will be. It creates a lot of diversity in the house and
Mhm.
sometimes difficulty in understanding where each one
Yes.
is coming from as well.
Yes, it's very much like that. Like again, if we look to a relationship also, if it's very complete opposite,
Yeah,
if there is Manapuratham also. Like if we are okay with mind, we love each other. It's like side part, but otherwise it will cause a lot of trouble. Like
it
you would have
will.
noticed many people have those issues.
I didn't look at it from the lens of Ayurveda in terms of relationship problems, but hey, I just might next time.
Yeah, there is a lot. Like if you look, they will be complaining about two different things. Okay, if you the
Yeah.
husband will be complaining about this, he will be like, okay, she's constantly talking, she's constantly complaining, she's like
hmm
that, she wants to do that. I'm not bothered much of anything about it. I'm just grounded. It's like they're two different things.
Yeah.
So that can also cause some issues with them, but it also depends on the person, okay, how much they
Yeah.
love each other and what they have and the connection they
Understanding,
have. Yeah,
communication.
understanding. And that also dates. But if you look to some relationship nowadays, most of the problems are like because of these things.
hmm
At least some of them. There are other issues also, but still, like those fights and issues between them, all those are like changing in uh doshas.
Interesting. I want to take a slight detour. I know we're talking about gut and mental health.
This
Um,
is a problem about me. Like if I talk, I will go on
no,
and
this
on.
is not a problem actually. This is very fun. I can see your Vata and Pitta coming out, going from here to there. This is what Vata also looks like, right? Jumping
Yes.
from one thing to the other.
Yes.
And the
But I will say I
excitement.
have not got the good parts of Pitta much. I have that
Yeah.
good parts all got from the Vata, and the bad parts of Pitta came in between,
Yeah.
like that
We may just,
anchor.
uh-huh. I would love to talk to you about it sometime later in the conversation, how to go. And it's not as simple as to say, do this, do that, of course, but the
Yeah.
slight things that you can offer. But looking at it from the relationship perspective, I got curious. So how does the sex drive differ from Vata to Pitta to Kapha?
Yeah. Kapha person, again, they are grounded.
Mm-hmm.
They won't have, it's not like they have, it depends on the person also, like what the food they eat. If they eat a lot of pitta increasing, like spicy, all those things also matters. But if we just look to their prakriti wise, kaba person won't have much of a sex drive.
Okay. Or would they have
And
more of a stable sex drive?
yeah, stable, like not too much. That passion and new
Ah,
things, everything is of Pitta thing.
yeah. So
But
basic missionary is fine for
yeah,
them.
basic missionary, basic thing what we do every day, that's
Yeah.
fine. And they won't have that much desire to have try new things or anything
Mm-hmm.
like that. But it's like grounded, like they won't have to do it like what 3 times a week or something. They will be like fine with 3 or 4 times a month. It
Mm-hmm.
depends. It also depends on the person if we look to, but still, as a Prakriti, if you're looking to
Yeah.
Prakriti, they won't have much of a drive, and they will be fine. And with this, okay, and they will slow and steady. We say
Right.
like slow
Mm-hmm.
and steady. That how the speed of the uh sexual
Act.
intercourse also is like a slow and steady for them. But
Mm-hmm.
if you look to a Pitta person, they will be like very desire, like that fire, what
Mm-hmm.
we see in cinemas and everything, that fire and desire, going out, having making out in other places, all those
Yeah.
that desire new thing is of Pitta, and they will have more
Mhm.
sex drive also.
Yeah.
And if you look to a Vata person, Vata is always like irregular.
Sometimes
Sometimes
up, sometimes
sometimes
nothing.
down. Whatever, even if we go to like how Vata related fever is, the temperature is also irregular. Sometimes the
Mhm.
temperature is high, sometimes down. So that's Vishamata, or regularity is a sign of Vata. So Vata person will be like, okay, sometimes it's high, sometimes it's low.
Yeah, quite irregular that. And
Yeah, and they
Vata
will be
is
fast
also,
also.
they'll be fast.
Fast. If you look to
Ah.
Vata person, that Chalaguna is there, like moving, all those things is also part of Vata.
Hmm. Interesting way to look at it. So Vata, can you also say that the Vata is also quite influenced by their environment, right? What's happening outside.
Yeah, their mind will be like very, again, that irregularity will be there. If something has happened anywhere, it will be there in their mind, like on and on, and they
Yeah,
won't be able to focus on any other things because their mind will be on that thing for a long period of.
true.
But if you look
Yeah.
at a cover person, they will be fine. They would have like left what's happened before, and they will be focusing on what they are doing at that moment. So that
Definitely.
ground thing is there for.
Yeah, the internal anchor grounding is so strong in kapha that they're okay. The self-assured part comes in again. So I'm also
Yeah,
linking it to self-esteem issues or yeah, self-worth. So vata can vary a lot. If someone says very good things, the vata person might feel inflated sense of
happy.
achievement. But if someone does not, so maybe that goes down.
That
It's
will
quite
affect.
hmm,
And
yeah.
if you ask the Pitta person, they will be arrogant, they will be
Ah,
angry. Yeah, if you say bad things about me, I won't be fine with you. I will just
cut
fight back.
off.
That, yeah, cut off, or they will get angry, or they will like fight with them. If you would have seen so many people like that. Uh,
I am. It's very new for me to look at my clients from the lens of doshas. Would you say that Vata people, like Pitta responds to criticism with anger or, that sense, ki, how
arrogant.
dare you? A sense
Yeah,
of
you don't talk.
revenge, maybe.
Yes, revenge, anchor for us, revenge.
Mm-hmm.
It's not like proper self-esteem. Like if you look to a Kaba person, they will know like what's good, what right, mostly,
Ah,
okay? And they will like, okay, if I made mistake, I'll be like, sorry, I've
yeah.
made a mistake, and this is
But
what
Pitta
if,
has like a fragile ego.
yeah, they won't that ego thing is there. They won't accept that I'm wrong. Like there
Mm-hmm.
are changes, okay, depends on the person also, like what their life experiences
Yes.
are, how they have brought up, that also affects mind and how they respond to each thing.
Yeah.
But it's how it's basically like
Yeah.
for a pitta person.
There's
But
nothing
it
to
can be like,
generalize.
yeah, it's
Because
not
we're
like
talking about having this conversation, so we are sort of generalizing, but it varies from a person to person.
person to person. Unlike physical symptoms, mental symptoms we can control if we have like a good strength or power, we say. That
Which
mind
also
power.
need to be built. As a therapist, I'm intervening here because I see this concept coming up quite often. Like, if you have willpower, you can do anything. But there are a lot of factors that influence the willpower,
Yes.
motivation also.
Yes, but if you, and that's again come to the Prakriti. For a Kapha person, they will have that naturally. For a Pitta person, it's different. For a Vata person, they won't have much of that. So
Yeah,
it's
so
not
it
like
will be more difficult.
yeah, it's different from person to person. We can't generalize. Still,
Of
how
course.
they have brought up and their life experience can also change how their willpower and everything is.
Yeah.
Till a
Yeah.
Vata person who have like had so many experiences like that, with time he would have like strengthened his willpower and he's more
Mm.
strong, unaffected by those things. It can also happen. So I'm not saying if you're a Vata you have this, if
No,
you're
no, no,
Kapha,
no.
it's
Yeah.
again depends on person.
That's one good thing about Ayurveda. Whenever I read about it, listen about it, or even when I take consultations from you, it never says that this is it. It always offers that opportunity to change, no matter wherever you are in your physical, mental health journey, or even age. It always says you can change even right now if you start here. It's not set
Yeah.
in stone. Yeah. And
Yes.
I see what you're saying about, so I, because I relate to being a Vata, when I was doing regular yoga or I was waking up at certain time, I was following certain practices, or I was maybe meditating, I was reading certain types of text, I could see my motivation with, I could see that groundedness coming in.
Yes.
So it's not
This
impossible, but it's about how to get there. It's that is a journey.
sort of Vata person differs. Like for you, yoga works better, like
Hmm.
slow yoga. If you do
Yes.
like very fast workout, I think you would have noticed you will have more energy.
Oh
That
yeah.
may be the opposite of
When I was
ground.
doing Ashtang yoga, like Ashtang Vinyasa, so it's like flow,
Very
this,
fast.
that, the other. Yeah. I was like, okay, I'm tired. My energy has drained out, or maybe I'm a little more aroused in a way. So my mind will go faster.
Yes.
Yeah.
Everything activates that energy. Like it's again that air and space energy, right?
So
So that increases with fast workout. Pitta and Vata increases, and those workout reduces kapha. But if you
mm-hmm.
look to yoga practice, it's more grounding. If you do it like a slow and steady like that, so for a vata person that will be best. But for a kapha person, they will need that fast workout to get their energy up. They will be like
Energy.
lazy and like not motivated. But they, if they do this fast workout, that energy comes up. That vata and pitta uh, slightly increases in their body, so they
Yeah.
will have like more energy throughout the day. They can do more better things, a lot of things like that.
Yeah. What what mental health conditions, be it disorder or non-disorder also, do these people with different doshas lean towards if there is imbalance? You've already mentioned kapha depression. What other mental health conditions, issues can they lean towards?
So we can generally say, again, it depends on how we take it, right? So kapha person also, it's not like necessary they will have depression or anything.
Yeah.
It depends on how they perceive things, what happened to them, or how they okay, we say okay, if I go deeper it will be like a lot ayurvedic, but generally we can say for a kapha person there will be a tendency to get depressed easily, and for a vata person a little bit like anxiety, restlessness, all those things, and for a pitta person anger issues, like very
Hmm.
angry, arrogant, those issues. But
Yeah.
also depends upon their food habits, how their
Yeah.
digestion is, are they working out, or
Mm-hmm.
whatever practice that's beneficial for them. For like vata person it's more grounding, for kapha person like a little fast workouts. So it also depends on their life habits and what food they take. It also depends on that, but it can be like for a pitta person it can be related to more anger related issues, but we can't generally say. And
Yeah.
mostly the sleep issues will be for a person who have high vata or pitta in them, or both. So it's not like one thing.
No, of
It's
course, there's no one thing. I'm asking because I was reading this book called Introduction to Ayurveda, written by Vasant Lad. And
Mhm.
in that book, they said that how people with Vata, not to generalize, but because it's a book, so of course they will be giving some basic guidelines, right? They said people with Vata have more, they'll feel more lonely, isolated. Yeah.
Yeah, uh, in a way, in
Mm-hmm.
a way. It also depends on, as I mentioned, like their life experiences, their
Yeah.
practices, how their mental power or that willpower is.
Mm-hmm.
So Vata person have that tendency a little bit, but it also depends on person. We can't generally say like that
Mhm.
uh, in
Yeah.
like a platform like this. That's why.
Got it. Got it.
But
Now,
still, like
I
there are
respect you saying that.
tendencies. But the thing is, otherwise the people will think like that. Okay, I have. So nowadays everybody is looking for their prakriti online. Like they will have like 10 to 15 questions and they will answer. And I will
Mm-hmm.
show you, you're a vata person,
Know
you're a
your
pitta person.
Prakriti quiz.
Yeah, no, you're dosha, like
Yeah.
that. But if somebody listen to this and they think that okay, I'm vata, the thoughts also uh causes a lot of issues. So they might think, okay, I will have this issue that might turn to other issues. So
Mm-hmm.
these tendencies are there, but you can what control a lot of those aspects also with the
Yeah.
habits and food.
Yeah.
So it's
I
not
like
just
that.
yeah.
I like that you just mentioned it outright and you did not just share content for the sake of putting out content in this conversation. It's also about letting people know that, hey, this happens. You will get influenced if I say this.
Yes, but it also depends on other aspects also. But if I just say, okay, you're a Vata, you have all these things,
Mm.
that means they will think like, okay, that thoughts also can lead to diseases, right? So they will be
Oh,
like, okay, I'm
yeah,
a Vata
yeah.
person. If I listen to the podcast and they're like, okay, I will feel more lonely, I will get anxious, all those things. But it will be there in their mind. But when some experiences or something happens, what they know in their mind comes out
True.
in a way,
Yeah.
not completely, but in a way. So that can also cause, especially the mental health things, these can also trigger a little bit.
This is why I urge anyone who's going through a mental health concern to not self diagnose. Even from the perspective of Ayurveda, like Aishwarya is saying, there are so many things. This is what you're sharing is just 0.0001%, the very start of understanding yourself.
Yes.
As a practitioner, you might ask so many more questions, understand so many more things about a person before even getting to a point when you say, okay, this is what's happening and this is what we need to do about it.
You would
Yeah.
have noticed I almost took 1 hour for you and mom during the
Yeah,
first
yeah.
conversation.
I
It
love,
takes,
you're the first doctor who sat with me for an hour understanding. Okay, let me just ask you a lot of questions, not just about the present, but also the past,
yes.
different aspects of life. And I was in awe that 1 hour conversation with a doctor. Why? But now I know why. It is important. It's
Yes.
not to check things off that, okay, symptom A, B, C present, they have depression. Or XYZ
Yes.
thing, they have anxiety. No, it goes way
No.
deeper than that.
Yes, a way deeper. So recently there was one patient. Okay, so I have to explain a lot. So he was suffering from like he was not able to take a decision. He was lonely. He was that sense of happiness was not there. All those symptoms was there. He came to me with that. So I talked to him, and then I came to know his appetite was not good. He has a lot of constipation issues and gas issues.
Mhm.
So what this means is, so everything start with digestion in Ayurveda. Rogam sarve abhi mandagno. We say like if the digestive fire is less, it's not able to digest the food properly and assimilate it properly, then you will get diseases. It
Mm-hmm.
varies. For a lot of the things, our body will treat by itself if we
Yeah.
give the time. But
Mm-hmm.
if you keep on practicing those things with time and depends on the person, it will lead to disease. So one of the thing is, if I say, okay, if you do this viruddha ahar, or if you take fish and milk together, you can get skin disease. There will
Mm-hmm.
be a lot of people offended and come to me like, I've been taking this for a long time. I did not get a disease, no skin disease like that. It depends on their prakriti or how their body is. Their body will be fighting on and on to
Mm-hmm.
not let it cause it to a disease,
Yeah.
but it changes for a other person. It's like a general thing. So for you, if you take that, you will get like skin related issues, some acne popping up, or eczema, all those things. So psoriasis, it depends
Mm-hmm.
on the person. So if we generally say everything, it affects everybody, but how
Mm-hmm.
their body fight it and how
Yeah.
to treat by itself is why you're not getting a symptom towards outside. That's one thing that I have to tell everybody. So everything start with digestion. So if we are digesting properly, all the tissues get nourishment, and then you will be healthy. So Ayurvedically, health is not just like a good blood test. Like if the blood test is all normal, it's not like that. We say samadhadu, sama agni, sama malakriya, prasanna atma indriya manaha, swastha iti abhidhyati. Okay, I will explain.
Yes,
Samadhatu
please.
means all your tissues are properly nourished. Sama agni, if you have a good digestion. Okay. Malakriya, if you're excreting bowels properly, if you're sweating properly, all those urine, feces, and sweat comes as mala. So all that excretion part is normal. These three is the base. Your digestion should be normal. The excretion part should be like normal means for you. It also changes from person to person and their prakriti also. But for me, it should be my normalcy, my
Mm-hmm.
agni, my digestive fire, my bowel movement, my tissues, or all the reproductive system, all the systems gets nourishment from the good part of digestion, like that sara, or good part goes to nourish and bad part goes as mala, or
Excretion.
like this
Yeah.
excretion. If that good part is not properly formed, all the tissues might not get the nourishment. So
Mm-hmm.
like that, it can lead to which tissue is affected, which dosha is more that leader to that manda agni. So for a pitta person, if the fire is more, they will either burn everything very fastly, and they will get easily hunger issues.
Uh-huh.
After 1 hour of eating, they will feel hungry. Either their prakriti or vikriti, like the vitiation. So all those, why that reduction in the appetite happened, we have to check that and see which doshas caused, and then what all tissue did not get that proper nourishment.
Mm-hmm.
So these also come to a play along with these doshas.
Yeah.
So if the
So,
digestion is proper and there is a slight variation in the vata or pitta, it won't be like a disease. There will be like symptoms here and there, like you might get a dry skin, or you might get what, a little restless or anxious, but that we can't say it's properly as a disease form. Maybe a slight vata vitiation. Maybe you're not taking enough fats in the diet, or you're any that vata aggravating factors you're doing. That also can these show up as a sign, but it's not
mm-hmm.
like you have anxiety and all those diseases. It also varies how much vitiation is there. If your appetite is fine, all those things we have to look into
Yeah.
while diagnosing a disease, rather than just
Definitely.
vata pitta and kapha. I know it's
Yeah.
like a very, I tried to summarize to few sentences, but I don't know, did you get what I meant?
Yeah, I definitely did get it. What I got from it is 100% of concerns, issues, diseases start from the gut, be
Mm-hmm.
it the digestion power, be it excretion, absorption, whatever different roles the digestion plays. Well, it does start from the gut.
Yes, it does always starts from the gut, but some variation also there, but it's not disease. Might
Yeah.
be a sign. But if you are looking to as a disease aspect, that like I think you and I'll be able to see if it's like a disease or just like here and there you're getting
Yeah,
anxiety,
yeah.
anxious.
But the core, the root is digestion.
Yes, a lot with digestion. And it also what you can correlate the food you eat, as I
Mm-hmm.
mentioned. If you take a lot of spicy, sour, salty food, that can lead to anger issues. More in a pitta person because they already have that fire. So if you put a little more fire increasing factors like spicy, very
Mm.
sour, salty food, that pitta element or that fire element increases in them, and
Yeah,
they get more angry. So you would have heard about like rajasic food,
yeah.
tamasic food, like that. So it's like a
Sattvic, Rajasic, Tamasic. Yeah.
yeah. Sattva is like the normal, like if you're taking, there are certain things that Ayurveda say how to eat, what to eat, like that. But
Mm-hmm.
if you take a lot of spicy food, for a Kapha person, it won't trigger much because they don't have much of fire energy there. But if
Mm-hmm.
they add a little fire energy, it won't cause much of an anger issues in them, unless they are frustrated or any other things are there in mind.
Mm-hmm.
But for a Pitta person, it increases instantly. They talk a lot of spicy food for few days, they will feel more angry, they will have more heat in the body. All those things happens. And for a
Yeah.
Kapha person, if they take a lot of sweets and oily food, they will be more lazy and a little lethargy because they
Yeah.
already have those element in their body. And if we
And
add a
for
little
Vata, maybe alcohol will make them more anxious and jittery.
alcohol comes with Vata and Pitta.
Okay.
Alcohol is it's fermented, right? Fermented things increases pitta in the body. And
Mm-hmm.
that's sour, ferment things. So for a pitta person, they won't be able to. They should not actually drink alcohol, if you
Yeah,
say.
there's
Uh,
already, they're already angry.
yeah,
And
they
then,
already that they don't need more heat in their body. But for a kaba person, it won't. I'm not promoting anything, but
yeah,
if you
of
look
course, no, 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 no
general,
promotion of alcohol consumption or any
yes, if a
alcohol.
kaba person, I can drink alcohol, nothing like that. But
Yeah,
their body will be able to handle it
metabolize
and
that.
properly, yeah, properly assimilate it after that.
Got it.
Uh, for a
Got it.
pitta person, they already have that fire. If you add a lot of fire again, it can lead to that, yeah, explosion or something. And for a vata person, if their appetite is good at that moment, they might be able to like assimilate it properly. Otherwise, it can lead to other issues like.
Got it. Got it.
So it also depends on the how
Mm-hmm.
that person is.
So would you say that all the cases, clients that you get, it mostly boils down to their digestion as one of the important elements?
Main element, I would say.
Main element comes to the gut.
Yeah. If
Yeah.
you correct the digestion, everything. Okay, so if you, it's not like Ayurvedic medicine, how they work is different from modern medication. So
Mm-hmm.
we say Ayurvedic medicine first digests and then gives that work. So if the digestion is not proper and we are adding whatever good, like so many people eats a lot of almonds, pistachios, thinking they are healthy, but if they are not able to digest it, there is no use, right? The same thing goes with the medicines also. So if they are not able to digest it, they won't have proper action. It's
Mm-hmm.
like a cloth that's dirty and you're all trying to paint on it. Like
Ah.
if it's neat, all the colors will come out properly and it
Ah,
will
that's
be.
a great analogy. Yeah. Yeah, that is
But
why
if
when I shared my blood test with you, you mentioned that, okay, before you take any supplements, which is the natural course of action when you go to a doctor,
yes,
you said, okay, let's work on your digestion first.
digestion. Even if you take supplements for a short period of time. So again, the action of medicine is different from Ayurvedic. So eh, if you eat all the things that's needed for the body, still it's not showing that thing in your body. That means you're not able to digest it properly and assimilate it. That's why it's not able to give that action
Sure,
in
yeah.
our body. So first we have to correct it. And then still, if it's not properly assimilated, then if needed, we can take some supplements for short period of time, because it, as the deficiency won't cause any other trouble in the body. For that purpose, with that time, we can like work on the digestion and would increase the levels in the body naturally,
Yeah. Got
rather
it.
than just focusing on the supplement.
Yeah, of
I'm
course.
not saying supplementing is bad. Again, like, as that deficiency won't cause any other issues, we have to supplement it. It's body's need. But along with that supplement, let's correct the digestion so that naturally you get all those elements in the
Yeah.
body with
Yeah.
food and everything.
Yeah. So the gut, the
Yeah.
digestion, the gut plays a major role, and you've mentioned how it impacts your physical body, your physical health, your mental health, right? If the gut goes off, what are the different ways that it impacts the mental health if the gut is not functioning well?
Again, it depends on the digestion.
Yeah.
Okay, if the digestion is proper, everything is proper.
Yeah.
All the
What is
doshas.
the ideal that Ayurveda describes? That if someone's digestion is ideal, how would their
Okay.
life look like?
Okay. So they will feel hungry at proper interval. Okay. So within 3 or 4 hours after eating a meal, they will feel hungry. And after eating a meal, to an extent, they won't feel tired or lethargic unless they
Like wanting to
overeat.
take a nap.
Nap, no. They will have that slight energy in them unless you overeat. That's also one thing. If you overeat, you can lead to those symptoms. But otherwise, like, they won't feel like drowsy or want to sit down, want to take a nap or anything like that. The bowel movements will be very proper every day, but that's not strainful. It's like I have to sit in the loo for half an hour, then I
Yeah.
will pass the bowel. That's not normal. That means there is some issues either with your Agni, that's digestive fire, or the Vata in your body. So that should be proper. And we say Udgara Shuddhi. So if you would have noticed, if you take something heavy or if you eat outside, after some time you get a belching with the taste of your last meal. That should not be there after 3 hours. Depends. The 3 hours is like a general thing. It depends on the person also.
Yeah.
For a pitta, they will like digest fast, and within a few hours they will be able to digest everything, and the belching will be clear. For other person, it differs. Some days you will be able to digest properly. For a kapha person, it takes a little more time. So that 3 hours, we can't say after 3 hours I have to get that belching. But what's your normalcy? Before you were like, we say like, I was not like this before, I will say able to digest it more faster. That means there is a vitiation in you right now. So
Wait,
what's
that's a
your
what?
normal, like a vitiation, like some dosha or some, it's not completely healthy.
Okay.
It's not disease, but you're not healthy. That proper health is not there, but it's not like a
Somewhere in
disease.
the middle.
Yeah, somewhere in the middle or start. So that, what's your normalcy, within that time you're getting that belching. But this also depends on what food you eat. One day you're eating some idli and the time to
Yeah.
digest that meal, and after taking 2 rotis is different, right?
Of
We
course.
also have to look that also than just like that. And you will feel energetic when you wake up in the morning. You won't feel like I want to lie down for some more time, like toss around for some more time. There won't be anything like that. You will be very energetic in the morning. The
You wake
sleep
up
will
fresh
you
and
fresh.
rested.
Yes. That is also a sign of proper digestion.
Digestion.
And yeah, good bowel movement, good appetite, all those things are the generally we can say. And with no disturbance, like either be acidity, heartburn, gas, lots of farting, not the normal one, but if you're farting a lot with sound,
Yeah.
with some smell, that farting with sound is also not
Okay.
normal. That means
Should be silent.
yeah, a little
Okay.
silent, unless you had some other meal, heavy meal or vata aggravating meal, but that sound should not be there much. It's mostly like you would have noticed for some people, if they go to the washroom, you'll be able to hear them from the outside. That air pushing out. That it's vata that goes out, right? So if it's going with sound, that means that his vata is not completely normal. Like we have to correct a little bit. I don't mean it's diseased properly, but we have to correct. There is some imbalance somewhere in his body. So these are generally, we can say, signs of good digestion. And you will feel energetic. You won't be drowsy much.
What about the skin? How does that get impacted with digestion?
Skin is very much related to gut. Very much related. So as I mentioned, after digestion, good part goes to nourishing all the tissue, right? The first tissue we say is like Trasadhatu. It's like very basic. And one such place we can, there is dhatus is there in everywhere, but still we can generally say skin. So if the digestion is not proper and the first tissue is not getting good nourishment, it can lead to difference in like bad skin health. And also like pitta. If pitta is more, they won't have like a good glow in them, or that we say prabha. That shine or something will be there, right, for a person if they have. If you go to a like look to yogic people, you will be able to see more because they are more sattvic. Everything, most of the things will be following by them. So their skin will be like very shiny, like that. But if you look to a vata is vitiated, there will be like more darkness here and there. Also a little bit reduction in the glow, but still it's that here and there darkness. So everything connects with the doshas and digestion.
Yeah, I hear that. I see what you're saying, that digestion it starts from, but how it impacts, especially what mental health symptoms, not just disorders, but even the symptoms that you'll get, it depends on what is your prakriti, what is your dosha.
Yes, rather than prakriti, I would say like vikriti. Prakriti a little bit, but how doshas are in your body at this moment.
Yeah, at that moment.
At that moment. So if it's still prakriti, that can also, if there is some, if a kapha person take again a heavy meal, that can also affect. And vitiation can also lead. So it all depends on how the doshas are in your body at this moment. That will, it's not just prakriti, how it's in you right now. It won't be like as you're born. So all these prakritik, how the prakriti is shown or their constitution also get masked by this vitiation. That status. Again, it's person specific. Very different. So I as a vata predominant person and other person as a vata we will be both will be very different. The amount of dryness in my body may be a little bit, but for him, he might be having more dryness in the body. So the vata person also differs. It's not that I'm not much vata as him. Like we are both that vata energy in us, but how much is also
ratio of it.
Yes. And okay, for me, if I get more dryness than what's my natural, that's also a vikriti. Like it's a vitiation. It's changed from my normalcy.
Yes.
Yeah.
Yeah. And so how does the gut communicate with the brain? We're talking with relevance to mental health and all the concerns that can come about from it. So I'm really curious. It's happening in our gut, that indigestion and all. And okay, I understand from the external layer that there are doshas and this aggravates. But is there some physiology or anatomy that is described within Ayurveda that tells us, like for instance, in medical science, they're talking about the dorsovagal nerve, the vagus nerve, which connects, it's the longest nerve, it goes to our gut and different parts of the body. Now it picks up the signals from the gut and sends it back to our brain. And because of that, we have a lot of maybe different concerns, right? So
Mhm.
is there any anatomy or physiology described in Ayurveda?
No, it's more so we can as I mentioned, like again, the technologies are more. If you look to the modern medicine, they have a lot of technology, a lot of learning. So we are still that old textbooks we are learning. So many people that you're still reading that 5,000-year-old textbook, it's not relevant, but it's very relevant in this current time. But they have not talked about like that for a non-Ayurvedic person could understand. So if I talk to an Ayurvedic person, they will understand like, okay,
Yeah.
these are the Ayurvedic anatomy and how Ayurveda perceived anatomy is a little different from modern. It's not like there is no kidney or heart, anything like
Yeah.
that. But the words that they use for kidney, it's vrika, then pliha, like all those words are a little different. So they have not mentioned much as like a nerve or anything like that. But it's because we know anatomy and physiology now we are thinking that way. But if you just look at Ayurvedic terms, it's more than like connection. If you get like a vata aggravation, you will get that in your skin, in your digestion, in your mind. Maybe you will get a little constipated, your sleep gets affected, your appetite will be irregular, you get gas and bloating, you get dryness here and there, your hair gets dry. We can't say it's more connected with a nerve or anything, right? It
Oh,
happens.
so how does it establish that? I understand I might be coming from that medical lens of
Yes.
research. What is happening within? I want to know that. But I'm just curious, like the why of it. When even, you know, I don't know who established Ayurveda, but it Maharishi.
And no, it's Brahma.
Okay,
Uh, it's like we can't say it's like a god or anything.
yeah.
Brahma means within ourselves, right?
Mhm.
Within ourselves, we get the knowledge. We don't know what happened back then, but this is what we are
Yeah.
learning right now. So it can be like self with all the patients they are seeing, what all things they are doing, they are experimenting, they are doing this and see if it's helping that and see if it's helping or not. Like that they have written a science, but we can say it's like a Brahma, but it's more self with the
Yeah.
person who wrote it. So it's 5,000 years back, so we can't.
Of course. But do you think that is one of the reasons why people are a little skeptical about Ayurveda because it doesn't offer that sort of why or that research that
Yeah.
comes with modern science?
Yes. So the research, right? Uh, okay. So in Ayurveda, it has been practicing and going on for that 5,000 or more years, right? If something was not very effective, or if it was not applicable to everyone, what they say for this research and everything, they say it's if it's working for this person, does that work for other? All those things that they do, if something was not there like that for Ayurveda, that science would not be here
Hmm.
today. They would have stopped practicing it long time ago and
Yeah.
went behind other things.
So
But
one needs to
still,
have a sense of trust in the science and the doctor.
more, it's not just stress, but if you learn it, it's the truth. We can say it's I'm not getting that word, like whatever you read in those textbook, it's there in everybody nowadays. And what they have medicine they have given, if you give that to the patient, they're responding.
Yeah. So
that thing is
self-observation.
that thing is still there after 5,000 years. That means it's one of the biggest research itself, right? For
For
5,000
sure.
years,
Just not
everybody have,
documented.
yeah, everybody have been doing this and they're getting good results. That means it's, I don't know if we need more research to prove that this is right. And I don't know, it depends on the person also. For general public, as they
Yeah.
don't know about Ayurveda, they it's not wrong that they feel this way. But if you try Ayurveda, you will feel like half your
Yeah, and
life.
that's the biggest proof. I am,
That's yes.
yeah. So like how I got into Ayurveda and yoga is not like research or anything. I knew, okay, these are our ancient sciences, Indian sciences, and I wanted to experiment with it, see how it works out because it's much healthier, and I think it's much more what's the word? It goes to the depths instead of
Mm-hmm.
looking at just the top layer, tip of the
Mm-hmm.
iceberg. It goes to the depths of it. So when I started getting into it, consulting, thankfully I got consultation from a lot of good people. I read about it. I saw it in my own self, and that is how the science developed. So now I do not need to think that, okay, what is that nerve? What is that? I believe in it because I can see
Yeah,
it working out for
it's
me.
it's giving result. That means
Yeah.
if it's not that, I mean, it would have lost a long time ago.
Mm-hmm.
So there are, if a non-Ayurvedic person talks about it, there are so many irrelevant things in Ayurveda.
Mm-hmm.
So people think that, okay, they are not thinking it was written 5,000 years ago. So at that time, there was no, especially if you look to piles, we can say Arsha is just piles, but if we want to translate to modern terms for people to understand, we can say like piles. So you would have noticed like most people who are sitting for a long period of time, who are traveling, all those people have more chances to get that.
Mm-hmm.
Right. I think modern science also have accepted that fact, I guess. So in those period, they were written as, so if you either do and one work for a long period of time, or if you travel in, or if you sit in uneven surfaces or uneven things, or sometimes not in Arsha, but in some other disease, they have mentioned like if you travel on a horse, it can lead to. That
Mm-hmm.
means that pressure difference, or
Yes.
how that pressure is giving to the body is different. So if you look to, there is no horse today. So so
Yeah.
many people will think like, oh, it's not relevant in today's thing because
Yeah.
everything has changed, technologies
You
have
need
changed.
to suit it to the current context.
Yes,
It can be
suit to
different
the current.
things.
And the horse thing, if you look to, for a person who travels in a very what uneven road in an auto rickshaw, they will feel almost the same, but not as much as
As much.
on a horse. But still, a little bit change will be there. That their vata will be vitiated, and
Mm-hmm.
their backbone will have that pressure difference. So
Mm-hmm.
it we also have to see. Okay, at that time they were doing all these things, and this is how the world was, how people were living. It's a lot different from today. But if you look that knowledge today's world, we will find all those small things here and there.
For
So
sure. For sure.
most of the people just focus on that and say like, okay, it's
Yeah, it's
irrelevant.
redundant.
Yeah, it's an old science. But if you look deeper, you will understand it a little more.
Yeah. That's where the practitioners, the doctor's wisdom comes in, the kind of questions you ask. You can't ask a person, oh, do you ride a horse? You will ask different
No.
questions. Do you sit for a long while, or do you ride a bike a lot of time? So that is where you all come in and ask the right kind of
Yes.
questions suited to the
As
current.
I mentioned, like if you do this for a long period of time, the vata is what's vitiating, like
Yes.
generally. So you have noticed most of the people who are doing like a IT job also depends on person to person what their prakriti is. But still, for a person who's been sitting for a long period of time, they will have that gas,
Hmm.
abdominal blotting here and there. Also depends
Sure.
on the food, but still they will have that tendency to get that vata vitiation. So
Mm-hmm.
that's how we can correlate it. But if a person says it's irrelevant, it should not be like that, right?
Yeah.
Still, we won't be able to find those signs or symptoms in today's generation also.
Yeah. So far, you have actually managed quite well, Aishwarya, to describe what Ayurveda is, the foundation, the five elements, and the doshas, the constitution of Vata, Pitta, and Kapha, how it influences different parts of our being psychologically, physically, we haven't gone to the spiritual aspects, and maybe we won't for the scope of this conversation. Yeah.
Spiritual aspect is like a very high end, we say. I have not still reached to that point
Uh-huh.
to talk about how spirituality is. It's not just like you read Bhagavad Gita or you go to the temple. It's very different from what people think spirituality is.
Yes, yes.
Spirituality is very, what we say, like very deep and a very difficult topic to talk about. So even I have not got that much of insight to talk about
Mm.
spiritual thing, how our
But that
Atma,
wing is present in Ayurveda,
it's
right?
still present. It's a lot relevant that
Mm.
how that spiritual thing and how the prasanna Atma, I think I mentioned that sloka, right?
Yeah.
How a swastha or healthy person is. The second verse I think I did not explain that. Prasanna Atma Indriya Mana. Our mind, our sense organ, everything should be prasanna or at the best.
Mm-hmm.
Then only we can say it's healthy. So that Atma part is more spiritual.
Yes, yes.
So it's not just like energy or something, it's more deep to it. But I'm not at this age, I have not reached to that
Yeah,
point to talk much about it, because uh it needs a more sattvikata from our side and a lot of things.
sure.
As a
Yeah,
person living in this generation, I've not reached to that point of a good
yeah.
spirituality. I do have a little bit of tamas and rajas in me.
Yeah, of course. Yeah. And yet there is so much even within the physical and psychological level. This conversation might be 0.5% of the entire ocean of knowledge of
Yeah.
Ayurveda, like you mentioned, right? And sometimes from these conversations, because of our culture, we want to get instant results. I also fall into that, instant that, okay, Aishwarya has said this dosha gets into this problem. So if I join, if one plus, I add 1 plus 1, I get 2. So this is what's happening. So sometimes this conversation can seem deceptively simple to understand such deep themes and struggles like mental health, depression, anxiety, insomnia, or any other disorder for that matter, right? I i would like you to maybe walk me and all the listeners through a case, a client of yours, maybe who had a primary concern of a
Mhm.
mental health disorder or a mental health condition, so that we all get a little insight into what is that maybe you ask. I know you cannot tell everything. You also need to protect the client's privacy and information. But maybe what they came with, what you tried to understand, what you did understand, and what are the procedures, herbs or procedures you recommended them, if that's okay.
Yeah, I think I started with the case
Yeah,
before in our
yeah.
conversation, then I skip to other topic. But I would like to say his case right now. So he came to with me like a little bit of non-motivation, since he's not able to find much of happiness with anything, and he was not
And what
always
was the age range of this person?
uh I think he was around his 30s.
Okay.
uh as I remember, like 30 to 35, in between, somewhere in between that. And he was an IT person. He was as everybody, he was working from home.
Yeah,
And even though he started to go to the office, now it's like 3 or 4 days a week, and rest days it's
yeah.
work from home. So he was like a typical half people. I'm not saying it's bad or anything. That's how the work culture is nowadays, and that's how we have changed from our olden days. So he was working like that, and he will be waking up late in the morning, a little bit 8ish, 9ish, going to bed very late, like 1 o'clock or something. And he came to me with these things, like he was not able to take a decision. He was always doubtful, and he's not feeling that sense of happiness with anything. Like anything, whatever he do, whatever food he eat, he was not able to find that joy out of it.
Mm-hmm.
And he was always doubtful. He was not able to take a decision properly. So when I talked a lot about it, it came back to digestion in him.
Mm-hmm.
So his appetite was very low. It was taking food at uneven times. Like sometimes he takes lunch at 2, sometimes 4 in the evening. Sometimes he will skip breakfast and go directly to the lunch. It was irregular. And the same sleep also, either 11, either 12, either 1. It was also irregular. That irregularity was there in everything. And his bowel movement was also not proper. There was what we say, there was a pattern.
Mm-hmm.
2 days he will be constipated, and the third day he
Oh.
might pass the stools, and then again 1 or 2 days, or sometimes 3 days, he will be like a little constipated, then he will pass. And while passing also, that sound was there, like a lot of
Mm-hmm.
sound and effort. So as an Ayurvedic person, I connect this to piles.
Okay.
Okay, it's not like just that piles or something is there in the NS part. It's more deeper in Ayurveda. So
Mm-hmm.
piles or arshas, as I can see, is more related to mandakni. That is, you won't be able to digest the food properly, and you won't have proper hunger. And the apana vayu, that vata thing, is what leads to proper evacuation of bowels, right?
Mm-hmm.
That was vitiated in him. So for him, that vata thing was there. Okay, so that apana vayu vitiation. Okay, I'm going a little deep. I guess if you're not understanding, you can.
Yeah,
Uh,
no, I am listening to it. And for anyone who wants to understand more about Apana Vayu, I did have a conversation with the yoga instructor also, who mentioned about Apana Vayu and its relevance in menstrual health. So you can go back to that conversation with Mehek Gupta and know more about that. But yeah, please go on. I'm with you.
yeah, so that excretion of everything, again, the
Yeah.
menstruation, semen,
Yeah.
urine, flatters, feces, all these are externally what we can see as the function of Apanavayu
Yeah.
externally. Okay, so that was very much vitiated in him. If we have that good Apanavayu, he will be passing the bowels regularly without much effort or anything like that. So that digestive issue, maybe with his sedentary life, their uneven, irregular pattern of eating, sleeping late at night, all these things caused him, and the stress also, like with the work stress also affected his gut. Okay, his digestion got low, and in the same manner, the apanavayu was also vitiated. So if you look deeper to the ashas or piles symptoms, it is ashanka, that is that unable to take a decision, or doubtfulness.
Oh,
That is
and
ashanka.
Ayurveda mentions one of the
Yes,
symptom of piles as
yes.
inability to
If
take
you
decisions.
want, I can get the text here.
Yeah,
And
sure.
with let me check. I will take a little. Yeah,
Yeah.
somehow I got the same book.
Wow.
So if we look to that disease, it's mentioned the first itself, Hada Utsaha. He won't have that Utsaha or
More joy.
motivation to
Uh-huh.
do anything.
Uh-huh.
That's given in the first words. And Dina. Dina means he will be like helpless, like very what? Okay, it's very difficult to translate a Sanskrit word to English.
Yes. Yes.
It's like how you translate a Hindi word to English. So Dina means like
Yeah.
a helplessness,
Okay.
uh, like a loneliness, or you can say that also in
Mhm.
one way.
Like the
Uh,
victim sort of
Tired.
feeling.
They can't do
Yeah.
anything on their own. Whatever they do, they are not getting that good result, something like that. And there is kshama again comes around like that, not much of enthusiasm, again that helplessness, not having the energy to do all those things as a sign of
Piles.
piles. that is given in Ayurveda. So it's not just given as a mental health condition, but if you look to a disease part, it's given. I think one or two is also be there. Ashanka was also there. So it's like, as you can see, it's like, oh, I don't know. It's like a very, is it clear?
It's blurred.
So it's like somewhere you can see that dark
Yeah.
black, right? So it's like a very big sloga. All those are symptoms. It's not just constipation or they have like a mass in their anus part. So these are also symptoms that they have mentioned. So we
Uh-huh.
can't just say it's like completely piles only, but wherever his digestion is proper and his abana is vitiated, this is how it shows. That's the base of
Mhm.
it. So
Yeah.
when we corrected his bowel movement and his appetite, all those things came back to almost normal, but something was still there, like a little, whenever he did not sleep properly, he will still get that undoubtfulness and all those things. But it was way better how he started with. He got a little
Mhm.
motivation to do things. He was working a lot better in his field than
Yeah.
how he met me at that time. So it's not just like so many people will directly correlate to this depression and things, right? But in an
Yeah.
Ayurvedic terms, we don't just go like that. We see what's vitiated and
Mm-hmm.
what caused the vitiation and how we can correct it. So
Yeah.
if a person has, he is a Vata person, it was like that. For a Kapha person, this happens easily
Mm.
also. Like it changes from person to person. It's not like if I'm
Yeah.
an IT person, I'm doing this, I might get these issues, but
Yeah.
it
That's where the
also,
personal, like the
yes,
uniqueness comes in.
yes.
Yeah.
And his habits also. Maybe he, if he was having good appetite and taking food on time and sleeping on time, doing a little grounding
It
practice,
helps for the
and
self-healing
some
process.
herbs or something that you take to balance that apana.
Mm-hmm.
Or if he went to a doctor when that constipation started, it might not have increased this much.
Definitely.
Like yeah, it's like that. So
Yeah.
many people thinks like, oh, it's just I'm not feeling hungry, not an issue. Maybe something would have caused, I'm not passing the bowels. So we have to go a little more deeper what's happening inside.
Yes.
It's
Yes.
not just constipation or
Yeah.
like
So for sure, I hear you. I'm glad. I'm sure that this client must be glad that they met you and they were able to work through with it. And I'm also wondering, so this person's primary concern was the inability to take decision and that,
yes,
low energy.
and
Have
not
you
having any what
motivation?
motivation to do something.
Yeah, yeah.
It was his primary concern.
That was the, yeah, yeah.
So if I
Uh,
gave ashwagandha or something like that there, as he doesn't have much of an appetite, he won't be able to digest that ashwagandha or any herb that
mhm.
I think many people are like prescribing ashwagandha for all the mind
Yes.
related. So many things are there, I think, going on in the internet. So if he took that ashwagandha, that means he won't be digesting it properly.
Yeah, and it won't
But
help
then
that much.
it won't help. Maybe for a short period of time, with the power of that herb, he might feel something here and there, but that's not what caused his condition.
Yeah, got it. I'm thinking about so when I developed insomnia back in 2019, 2020, and I went to an Ayurvedic doctor in Delhi itself. So my primary concern was insomnia. Right? Like
Mm-hmm.
this, for this person, the primary concern was ABC that you mentioned. My primary
Yes.
concern was insomnia, and I do have a lot of trust in yoga and Ayurveda. So I thought instead of going to a psychiatrist or a general physician, I want to first go to an Ayurvedic practitioner. Right. So they checked my nerves, like the nadi checked. Yeah, they checked my pulse. They also asked me a lot of questions about my digestion, my sleep, my lifestyle, my work. And after that, they gave me a couple of these herbs and all, some in powders, mixing of powders, some tablets and all. And most of them, of course, it helped me a lot. It was about for cleaning my stomach. Like the doctor on the first consultation only said that, okay, there seems to be a lot of stuckness in your
Toxin,
stomach. Like there's a lot inside there which is not released. Yeah.
toxin.
Toxins, and I don't know. She was just saying that it's not getting cleansed properly.
Mhm.
And she checked my pulse, and after that, she said that. And if I relate it to the emotional aspect only, there was some correlations. Like there were some things that I was holding on to that was not letting go, right? And that was causing a lot of imbalance. So they gave me all of these herbs, primarily from my digestion, to cleanse first, and then maybe they change something. I'm not exactly sure. They also recommended me to have 3 to 7 sittings of Shirodhara, three regularly, like one after the other, and then for 3 days. And then after, I think twice, 2 times in 1 week, something like that. So this was my course of treatment, and thankfully, very, very grateful that after 3 to 8 weeks, I saw noticeable differences in my sleep. And I am here now. I don't say that I have insomnia, but that time Ayurvedic treatment went like a really, really far way for me. So as a layperson, I don't know what are the underlying factors that they saw in me, right? And that is what made me curious. That have you ever had a client who came with the primary mental health concern, like say anxiety, depression, insomnia, or even things like, having an eating disorder, any mental health condition that you can think of?
Uh, See, every person, if I look to, we first go to the digestion.
Uh-huh.
So that's a base thing. So when digestion is proper with time, sometimes some people will have more vitiation. We will have to add more herbs to balance their either vata or whatever vitiation is there. But still, we go to the digestion.
Yeah.
And the mental health condition like that.
Like I know
Think.
I came to you with that thing that, okay, I'm not sleeping very well. Yeah, I won't
And
say to the extent of insomnia, but I just said that, yeah, I'm not
yes,
sleeping very well.
and the gas issue also, as far as
Mm-hmm.
I remember, like
Yeah.
bloating, abdominal bloating, and everything.
Bloating, yeah.
So for you, when the digestion and all the practices that you're properly following, you will be able to fall asleep. I think you would have noticed on days that
Mm-hmm.
your digestion is clear, bowel movement was proper, everything gets on back to the track,
Yeah, and
right?
I'd say it's while digestion, I've noticed, plays a huge role in it. It's also a lot of other factors, like how am I psychologically feeling that
Mhm.
day, right? How satisfied I am, or just general things that add on. But yes, digestion is definitely a
But
big
if
one.
the digestion is very proper, okay,
Mm-hmm.
if I look to a 10% nowadays, only 1% might be having like a good
Mm.
digestion and
Is that
without
what
any
you notice?
yeah, like that's why I started like a gut healing program. But
Mm.
everybody is having gut related issues. Everything you ask 10 patients or 10 patients, there will be only 1 or 2 people who say, okay, they might say my digestion is proper at the first. But if you
Mm.
look deeper, it might not be proper. They might think this is what normal is, but that might not be that
Yeah.
healthy. With everything going on, they would not be able to focus it much. It's
Mm-hmm.
not their problem also. Like we have been wired like that a little
Our
lately.
culture is,
Yeah,
it's just very
a little
different.
lately.
Yeah, lately, actually. Yeah,
But in
so
the
I get
olden days,
it.
it were lot different. If they're not feeling hungry, if they're not, if they had a heavy meal, they will skip the next one.
Mm-hmm.
Uh, they will let that body to digest. They will do like a seasonal purgation. That
Yeah, but that's
action,
the thing I do not like in terms of how far we have come from our roots. Yeah, and if I see my great grandmother, maybe she knew a lot of these things, but from my grandmother and mother, it got lost. Like my mother doesn't know a lot. My grandmother maybe knows a little of it. And now
mhm.
I am the generation who has to pick up these books, talk to
Yeah,
professionals, and actually understand all of these things so that I can pass on to the next generations. But
yeah,
all of these, there's so much confusion, no? Like even when
Yes,
we fall sick, I have read, you correct me please, that if I have a fever, I should be eating very light meals and all.
very,
But
very light.
yeah,
If
but
it's
in our
possible, you
house,
should be fasting. If you have
fasting,
that
exactly, that's
physical
what
strength to
recommended.
hold fasting, you should fast till you get that appetite. But it also depends on,
Exactly.
it's not like some person gets fever, they have to fast, but if they
No,
have that physical strength to withhold fasting, they should fast. It's not light meal. We say that because nobody will be, if I go to a person,
fasting.
you would have noticed even in my, I can't say like that, in my husband's family, they are more in the city area and they have changed a little more.
Hmm.
So whenever I'm sick, they will be like, it's not their problem. They will be like, eat something so that you get energy.
Exactly. And
Eat
sometimes
something,
even to
have
things like
fruits.
bread, which is so heavy to digest, breads and all, which is okay, just
Yes,
have one bread butter with milk,
yes.
but it's so heavy.
Yes, so it's very different. It's not their problem. It did
Yeah.
not pass, it just stopped from their past generation. They did
Yeah.
not get that knowledge. It's not their problem. As I said, what
Mhm.
we know is what we reflect, right? So
Yeah.
they're thinking like we'll get more tired, so that eat something. They're talking about with their concern. So if I eat something like that, I'll be, if this fever has to go down in 3 days, it will take 5 more days because we have to
Direct.
digest that whatever they had also.
Interesting
So we
perspective.
generally, we can't say nowadays, okay, go fast means everybody will be like, what? I have to do fasting when I'm sick. That's
Yeah.
what they think. So that at least something will be there like that. We say like something light, like a very light watery porridge. Or
Mm-hmm.
as I mentioned for your mom, that Laja, what were you saying
Laja.
in uh
Kheel. Kheel.
heel? Yeah,
Yeah.
that's even more light than rice. So
Rice
something made
water.
out of that, yeah, rice soup or rice water.
Mhm.
It's more lighter. It gives an instant energy. It doesn't need.
Yeah.
So that's why I asked if she was not having much appetite back then. So something like that. I asked her to start with the water and then slowly include a little bit of ghee or
Salt
something.
and ghee. Yeah.
Yeah, solid part. So that also, of course, if she has like very heavy at that moment, it will take more time. So yes.
Got
That's
it.
why very light, very light. Let the body digest whatever is there. Let the, and after that you should not over fast also. Once you get hungry, you
Mm.
should not fast
Of
again so that it
course.
will be more beneficial, nothing like that.
Of
Whenever
course.
you get that hunger, you have to have something light. At that
Mm-hmm.
time, you should not go with something heavy.
Yeah. Got it. So, as we're starting to also wrap this conversation, which can go for hours and days
Yeah.
and weeks, because there is so much to talk about, and it's so interesting to hear these perspectives
We
also.
might not have covered most of the topic what we were thinking to discuss today. Like we've shifted on and
Yeah, that's okay. It's a good introductory aspect because at least I have read a few books, I know a little, but I do not want to assume that for the listeners and go to all the higher order conversations, right? This is a nice crash course, introductory crash
yes.
course.
So
And
what happens with the books is that it's general.
yes,
Okay. So, that's why again where the guru comes up. If they give you that, was, I'm not saying I'm guru or I have that thing or anything, but I know a little better than what normal people would
yeah,
know. So if they can clarify our thoughts and what we know, that would be like the best. So if I look back, as I mentioned here, they feed a lot of food, but still in my home, he'll like there will be like hot water will be there. I have to take like sip by sip. Wait, sometimes my mom out of what out the same goes like my family. They will be like eat something like at least an
yeah,
rice soup water, not water. She will say only water. Still, out of how we are, how tired we are, she might say that. But my dad will be like, okay, wait, uh, only eat when you're hungry. Like let's
yeah,
wait. And my family, it's not like a Ayurvedic traditional family or anything like that, but they had these small wisdom in them.
yeah,
Like they will not allow me to. When I was a kid, 10 is the max time. I have to sleep by 10.
Uh-huh.
Whatever you have to learn, get up in the morning and then
Morning.
study. Then study. 10 is the time to sleep. I still remember there was one, mine is like a very village area. So there was one last bus at 9:50.
Uh-huh.
So whenever it's like a village area, so rarely people honks and everything. You won't be able to hear any vehicle noise or anything. So it's like a round. They take a round, very 1 kilometer or more around my home. But still, I will hear that 9:50's bus honk, and I'll be like, okay, it's time to sleep.
Time to sleep.
I can stop studying. So I'll be waiting for that bus honk when I was a kid. So that's how,
Yeah,
like,
that's
you
such
have to
nice
sleep by-
memories.
because I'll be waiting for why is that bus not
Yeah.
honking? We won't have
Yeah.
much
Oh,
work
like I have to go. I have to stop studying now, please.
because I was lazy to study also a little bit. Like, I mean, okay, let me sleep. I can't. So I'll be waiting. I'll be reading something and be waiting for that bus honk. Okay, the bus honk. Close the
That's
text.
a cute memory to have. Oh my God, thanks for sharing. Yeah. Made
So
me
there are
chuckle
so
for
many
sure.
things like that,
Mhm.
and without taking a shower, there won't be food in the morning.
Mm-hmm. Yeah, a lot of nice, nice wisdoms, and that is why. So, even though I like reading about Ayurveda, I know it's very general, and even the books, small, small books that comes these days, they have very on the surface level knowledge. But
See, the thing is, if you learn about mathematics, you first learn about what is one, what is two.
Mhm.
If somebody asks you what is one, you might show them one pen or something like that. But
Yeah,
that's a pen.
yeah.
What one number is, you learned with time. You did
Mm-hmm.
not start with what arithmetics or anything like that from the start, right? You started with the very basic. With the English also, you started with ABCD,
Exactly.
not words or big sentences. So if
Mm-hmm.
you ask a first standard kid, if student asks, okay, what is the why am I learning these things? Even the teacher explains it's like this for the future, he won't have that knowledge to understand that.
Absolutely.
And the teacher will have more trouble to understand them. So it's same way goes to an Ayurveda. You have to learn a little bit of basics of that
Yeah.
concept, and at that time you might not know, okay, why am I learning, what's this, what's dadu, what's dosha, what's prakriti, what's vikriti. That confusion will be there. But with time, if you learn and more about it, this makes sense with time.
It of
Like,
course does. And it's, I'm not discounting the power of those books because they have given me a foundation for
yes.
what more I will learn and even to observe my own self. I will
Hmm.
not take the books at face value because every person is unique, so am I. So
So
just
it's a
noticing.
general thing. So it's that
Yeah.
very
It's a
general.
template. It's a template for me.
Yes.
Yeah.
So
And
it's
then,
like
of course, beyond that, why I'm saying this is I value our consultations
Mhm.
because there is so much that I don't know, and there is so much that you know because of your professional and
Yes.
experiential knowledge. So I can do all of the experiments I'm doing at home. At the same time, I can lean on a professional like you who
Mhm.
can guide me. You're
Yes.
almost like even if you're not comfortable, you are my guru in that way because you are guiding me, you are helping me understand myself better. And in our consultations, you've never said that this is what it is. You always also offer me to tell you that no,
Mm.
it's not like this because
I have not thought about like that. You're the first person saying that. I don't know. Do I?
I noticed that, yeah. Even when you say, okay, maybe this is happening, and I tell you, no, this is not the case. This is something else. So you respect my thought because, and
Yes.
I'm reading between the lines because you're respecting that I know myself the best.
Yes.
Yeah.
A lot better. But some things, if you, even though you know better, there will be some things that I know why that happening.
That
What's the
is the amalgamation. So my
yeah.
knowledge about myself and your knowledge about Ayurveda and how we combine those two elements brings out the beauty of the science, right? And on that note, as we're talking about it, because I there is no generalized thing. And yet, if there are some things that you can give to our listeners about what they can start doing or looking at to promote a better, to promote gut health beyond the generic things that we find on internet these days, like eat on time, sleep on time, don't eat junk food. That is all is established. From an Ayurvedic lens, if you can offer 2, 3 pointers.
Okay. So again, it depends on how much appetite he have. So I would always ask somebody to prefer at least 80% of their meal to be something light and warm or freshly made, with a little bit of good fat in it. Good fat doesn't mean like avocados or anything. A little bit of, or little bit of oil. It
Something
also
more
depends on,
affordable.
yeah, it doesn't need to be like very like nuts or something. Something like a little bit of ghee. Again, you have to have that appetite to digest it. Otherwise, like ghee made food can also cause trouble. But if you have good appetite, 80% of meal make like this. And don't eat 80, at least 80 or 70% in today's time. Eat till your stomach is half filled. You don't have to like fill every time, like completely filling it.
Yeah.
Take your time to chew the food. Sit and focus on the food that you're eating, not like scrolling through the phone or watching TV or talking.
Yeah, digestion starts in the mouth.
Yes, and how your mind is. If you are thinking about something else, or if your mind is anxious or like that, your action will also be like that.
Yeah, it is a tough one. I am so used to watching some series and eating, so used to it.
That if you focus on the food, you'll be thinking, okay, I'm eating the food. You're giving your gut a sign also, okay? That smell, it starts with the smell, then the taste, and then you eat it. So that your gut will know, okay, the food is gonna come. I'm feeling hungry, but still the food is gonna come. These all things I have to prepare for the food to digest. So it starts them there. And if you wash your face and hands before eating a meal, it's not just for clearing the impurities. So if you pour a little cold water, not ice cold or something, normal room temperature water, it will ignite a little fire.
Is it? Okay.
Yes, hands, face, and feet, we can
Feet.
say. You would have seen older people doing that. They will, we say kindi in Kerala. It's like a small instrument, like a cup or something. They will wash their legs, they will wash their hands and face before eating every meal. They will do that. So
Okay.
this way, it's improving so that see the sparsha, like a little cold sensation here and there will focus at not full body bath with cold water or anything. That will like your body will be have to maintain the temperature a little bit towards external. But if you do this, that fire gets ignited a little bit.
Okay. I'll start doing it right after
A
our
little bit.
conversation. And maybe at dinner, I will do that.
Yes, I think most people wash hands nowadays, but if you
Yes.
can wash a little bit of face and
Feet.
feet, that
Okay.
helps in one way, a little way. It's not like if you do this, you will have good appetite or anything, but it's one small practice. Or you can make your dinner light. Most people eat dinner very heavy nowadays. So make your dinner light is uh one of the common thing that I ask everybody to do. Unless you're sleeping at 1 or 2 in the morning.
Yeah.
So
The
if you're sleeping
normal sleeping times, like
yeah, if
9
you're sleeping
to
by 10,
10:30. Yeah.
yeah, 10-ish, maybe maximum 11 o'clock or something, maximum.
Make
That's
it light.
so if you eat a meal very early, you will digest it, process it, and by the time you sleep, that digestion part would be over. Then your body has to go on the reset mode,
Yeah.
metabolize everything, balance the hormones, so many things it happens at night. But if you eat late at night and then a heavy meal and then go to bed, your body will struggle a little bit to digest it. reset the body,
Yeah.
and the digestion won't happen properly because you're sleeping. That I mentioned, like fire is what digestion happens, right? A little bit of vata also, okay? It's not just fire, a little bit
We
air
need
also, heat
air
inside.
also. True.
So at that time, if you sleep I mentioned is like a kapha predominant thing. Grounding thing, if we do that, it's opposite of all these things. So you won't be able to digest that food properly. So if you're sleeping by 10, have an early dinner. And if you're
Noted.
sleeping 1 or 2 and having an early dinner, means you will be like, your body
You'll
will
need to
digest
have a
everything.
lot. Yeah, yeah.
If food is not coming, it will digest all the good parts also.
Oh, okay. That is also important to know that if there
Yes.
is, you have generally mentioned to me that there needs to be some 2 to 3 hours of gap between the last meal and sleep. But you're
Yes.
saying that if it goes beyond, sorry?
Beyond. Yeah, generally, it depends. Again, the
Really?
time to digest is also what you have taken,
Yeah.
your dietary pattern and everything. So if you're
Yeah.
sleeping 1 or 2 in the morning and you had a dinner by 7 in the evening, there is a lot of hours there, right? And after
Yeah.
10, the pitta is more in the nature and our body. So at that time is what metabolism and resetting happens. At
So
that time,
during that time, you're
during
saying,
time, if you're waking up and if you had a very early dinner, it's not good for the health.
because it will digest the good parts, not
Good
digest,
parts also. It's
burn
very
off.
hard to burn off. It's not fat,
Mm.
but it will lead to, by burning these good things, we say like vata vitiation. So
Okay.
can lead to vata related issues. So it's very difficult to explain to a crowd
Okay.
what is the good part. And because we think in a it's not our problem or anything, we know a little bit of anatomy and physiology. So the good part will be like, okay, am I burning the fat or am I burning the other things? Like our mind goes in that way. Even
Yeah.
it was like that for me when I started learning, because we were learning the modern thing, Ayurvedic thing, but with time it comes to you.
Yeah. Just
So
give it
it's
some
not good.
time.
It's
It's
not
not
good. That's the base.
noted. Noted. It's not good. And are there any practices? I don't mean practices that I can just do at home, but even after consulting a doctor, what are the general practices that you recommend to keep the gut healthy? Maybe like you've mentioned the vasti, right? It is about for the gut to cleanse the intestines.
Okay, so if you look to the term enema, you think it's just to cleanse that
Hmm.
largeness, and because the medicine is only going to the rectum and it's coming out. So,
Yeah.
but if you have anxiety and all those vata related issue, if you do a vasti, depends on what you use. So the
Mm-hmm.
vasti is generally two types. Okay, just the oil and like a mix decoction, oil, salt, honey. A
Herbs.
lot of things goes into one kind of enema. So depending upon what we are using, we can treat anxiety to infertility to a lot of things. And even for a person who have joint pain or
Mm-hmm.
arthritis, they gets beneficial from the vasti.
Mm-hmm.
For a person who have not complete paralysis, then we won't be able to do. But if they can do a little bit, and here and there is some weakness, and then if we do vasti, they also gets beneficial.
Okay.
The vasti also help with the healing of ligament also. Ligament healing, I think I have not practiced that much, but one of my guru in my Ashtangam college, he will treat the complete ligament injury with vasti and external treatment. So complete ligament injury, usually nobody treats with Ayurveda, they go with
Yeah.
surgery. But he treats it with vasti and other treatments. So if we look to what happens if we put some medicine to the rectum and within 1 or 2 minutes coming out, what is, there are some things that we can't explain in modern anatomical thing. But if you do that, we are getting the result there. After 5 or 6 months, if you take a scan, it would have 80% or 90% it will be healed. Some or
Mm-hmm.
will be there here and there, but it will
Yeah.
be healed. But nobody will accept that
Yeah.
how the enema is helping that, but it is helping. So it has that
Sure.
action on overall body, but it's primarily for vata dosha. Okay, I can say
Got
generally
it.
primarily for vata dosha, but with the medicine. If you're
With
using medicine,
medicine.
using
Yeah.
what medicine we use, we can also treat Kapha related issue. We can
Mhm.
also treat Pitta related issues. It depends on what
And
we use.
yeah, and that the doctor decides depending on,
Yes,
yeah, the client, right? So
Vasti.
enema is one, and that is beneficial for depression, anxiety, you mentioned, even insomnia, different things.
Yes, insomnia, anxiety, depression, not much, but
Okay.
more anxiety and
Anxiety, insomnia.
those issues.
Yeah.
Insomnia, then healing ligaments. If I can look deeper, like almost many diseases that has a beneficial
Yeah.
physical and also
Yeah.
mental. For a
Any
Kapha
other
person itself,
procedures? Yeah.
sorry.
Any other all of these procedures that you know that they benefit a lot for mental health concerns
Mm-hmm.
along with enema?
That we can do at home. Like,
No, home or otherwise. I'm just curious to know.
okay, so the Shirodhara is one thing.
Shirodhara.
Shirodhara. It just calms down the whole body. So our body is like a inverted tree. This is
Mm.
our root, and this is
Ah,
how our branches are. So same way goes that if we treat here, it will have that effect on
yeah.
the, not like Vasti, but it will have some benefits in the whole
Mhm.
body.
Yeah, and
So
Shirodhara, for people who don't know, it's basically you lie down for 50 minutes or 60 minutes and they pour like oil on your
warm
warm
oil
oil.
in a regular motion from here to here.
Yeah, though the ends of the forehead, and it's really relaxing. It's like a massage for your brain.
Yeah, you will sleep better. Everything will be best. But Shirodhara is not for everyone. If you
Mhm.
have a lot of phlegm related issues, uh,
Kapha. Yeah,
kapha in the, especially in your upper part, it can because we are using
aggravated.
oil, right? So the
Yeah,
vata and kapha is two opposite, as I mentioned.
true, true,
So
true.
that kapha related issue also can come up. But
Yeah.
Shirodhara, if it's indicated in you or for the person, it's really works wonders.
Yes, so Shirodhara is one.
Yeah.
Enema, Vasti is one. What
And
else?
then purgation, that variation or medicated purgation also helps if you have a lot of pitta related issues like anger. Unlike Vasti, this purgation is a little different. Vasti is
Mhm.
like gut brain axis. There is another rectum and brain axis
Okay.
as we speak. So there is different, but variation is mostly for like anger, excess heat, that
Mm.
kind of issues. If mental health issues are coming up like that, variation also help. But for depression, vamana or like medicated or what vomiting
Mhm.
helps, but it also depends on his mental strength.
Okay.
These unlike vasti, this variation or purgation or vomiting treatment needs a little willpower,
Mhm.
because we'll be taking ghee only for like 5 or 6 days. Then we will have to take medicine and vomit all out. So that needs a power. So if it's indicated for a person, that also helps in one way. Because I remember I did this vamana, it's medicated vomiting in my college, and I was like after uh I was a student, okay, back then, and it was some holidays, and most of my friends was home. Only
Yeah.
people who are very long away from their home was staying in the hostel. So after that vomiting, it happens in the morning. After vomiting, I was a little tired at the end of the procedure. It does not happen like that, but I was tired, so he was helping me to get one vehicle and take me to the hostel. So when I reached the casualty, I got one more urge to vomit. Okay.
Uh-huh.
So I called him, Aisha, I'm getting a vomit. Please get me something because I can't vomit in a casualty, right?
Uh-huh.
Still, patients will come, everything. And so he took me something and I vomited to that. But after that vomit, I was so energetic. I was light, like I
Wow.
was flying. So I asked him, cancel the vehicle. I will walk to the hostel.
Oh,
But
wow.
after that, half my mind was clear. I was so focused. I was so good till I did all those other practices, but still for a long period of time it was so good. I was able to read better, learn better, the focus was different, everything changed. So that Vamanam, or that medicated vomiting treatment, also has a lot of effect in the mind.
Mm-hmm.
As it was more indicated to me, I did that, but some of my friends was also doing other purgation and other treatment, so we were experimenting on
Yeah.
ourselves at that moment. So they had a little different things. So for people who did purgation, their anger issues came down a little bit, but it also depends. It's not like I have anger, I can do this
Mm-hmm.
purgation. Depends on how much you have. If you don't have much vitiation, we won't do that. So it also depends on the person that's doing it. It has depends on the person how much vitiation, but these treatment also help. It's
Yeah.
not just Virothara also.
Yeah, interesting. Interesting you're talking about these. And I really like that you're talking about um l- even though these days the clickbait, the clicks are more on these labels of depression, anxiety, insomnia. What makes up these conditions is this heaviness, right? Sadness,
Yes,
hopelessness, lack of motivation,
yes,
restlessness. So it's
yes.
not that we only need to treat it when it gets to that level, but it's important to treat it from the very start, or even, prevent it. So when you're
Yes.
talking about you had that heaviness, you did not feel like doing a lot. When we leave these symptoms be, when we do not focus on them, they accumulate and they form something even bigger that might get into a diagnosis. But it's
Mhm.
important that you're talking about these procedures that help it from the very starting.
Yes.
Yeah,
That
yeah,
moment, even I feel like I want to do a Vamanam in these days, but
yeah,
it's like a very big procedure I can't do on myself. Because
yeah.
this vomiting, we can't say it will stop like that. For some
Mhm.
people, if it goes beyond that, we will need some doctor along with me. Even though
Yeah,
I'm a doctor, I can't treat myself at that
yeah,
moment
and
because we'll
that's
be
the
vomiting
one,
more than
of course, you're the patient during that time.
yes.
You're the
So
client,
we'll
and
need
you don't have to
someone
be a
to
doctor all the time.
even
Yeah,
though I myself am a doctor, I won't do it alone. So I have to go somewhere or and take rest. There are a lot of things that we have to do in these 7 days, 8 days, depends on how much we have. So I feel like I need that right now. Something is there here and there. So with a little bit of change in lifestyle and everything, even
yeah.
we do have
Of
issues. It's not
course,
like
because it goes without saying. My last conversation was about the mental health struggles of mental health professionals. So it goes for everyone. Doctors struggles, Ayurvedic doctors struggle, mental health professionals struggle. We all have our own personal life going on. We're all doing the best we can, working towards a better version of
yes,
ourselves. And I'm
every
very happy that you said that you are also struggling. So it sort of demystifies the image of a doctor, a perfect doctor. That does
yes,
not
even
exist.
I do these things like 20% of time because I'm also, as I mentioned, I have class, I have work, I have online consultation, I have to
Yeah,
make content. I think we talked about this before.
yeah,
And there's a lot going on in our lives also. So
yeah,
sometimes we also don't get much time as everybody. Sometimes we might not be able to do things certain way. Sometimes
yeah.
it happens in
So true.
everybody's life. So if
So true.
anything is like that, we have to correct. If it's beyond that, we have to get
Yeah,
some treatment. So it's
which is a
not
big
like I'm an
warning out
Ayurvedic
there.
doctor. I
Mhm.
follow everything all the time, 24
You're
into
a
7.
human first.
Yes, and the lifestyle also have changed.
Of course.
Everybody is busy. We are struggling. Like things have changed. We have our own personal lives and financial thing is there. For that we have to work a little more, still we struggle here. So
Yeah.
those things are there for everybody.
Yes.
So with
Perfect.
that, how much we are able to incorporate Ayurvedic practices, we can do that so that it won't get a lot worse,
Mm-hmm. Yes. Agreed.
and we can prevent it also.
Yeah. Agreed. Perfect. And with that, I guess it goes without saying to not try to do all of these purgations and Hamas medication at home. You need to be under a professional supervision. Go ahead, talk to Aishwarya if you want. I will mention the contact details in the show notes, and she will also mention it. And if there are other things, you can reach out to your local Ayurvedic practitioner. Just seek
Anybody,
professional
yeah,
guidance.
anybody. It's
Yeah,
not just me or somebody who have some practice and
absolutely. Absolutely.
uh,
Yeah.
experience and everything. If you talk to them, they will also guide you.
Yeah.
It's not like I talked about all this, you have to talk to me. It's
Yeah.
nothing like that.
It's a
So
choice,
it's a
definitely.
choice. If you have somebody nearby your home who's having good results, have experience, go talk to them. Face-to-face consultation is a lot better than online, to be
Mhm.
honest.
Yeah.
So nowadays, as everybody is missing, we have to do these things.
Yeah.
So that is also one thing.
Yeah. Perfect. So last question that I have for you, Aishwarya, is that if someone wants to start learning or reading about Ayurveda, what books, resources, channels? Of course, one is your follow Aishwarya's Instagram channel. That goes without saying. Any other resource that you recommend, especially when it
So
comes to the gut?
but there are a lot of basic books, as you
Yeah.
mentioned, like Vasanladsas and many, but you should not completely not saying some disease or something like that. Okay, they have given this much symptoms, so you should not self-diagnosis or self-medicate.
Yeah.
But to know the basic, you can first read any of those. Okay, like what is dosha, dhadus, and everything. And after you get a proper knowledge, I would say Ashtanga Hridayam is like a very good book. So you do have it's Sutra Sthanam, that is Dinacharya, and
Mm-hmm.
Rudracharya, that is Sutra Sthanam is for maintaining the health. For
Mm-hmm.
a healthy person, what all things they should do, how to eat, what to do, what foods to eat, everything will be given in that. So if they want to learn about that, that would be the start, I would say.
Mm-hmm.
So I don't know if there is any other translated much book. I can't recommend any of that. So if you have any of this, I think would be better. So learn something like that. So basic. What is
Yeah.
dosha, dhatu, mala, shrotas, all those things. And then slowly, if you want to learn more about Ayurveda, you can go with Ashtanga Hridayam. So that
Sure.
with time, as I mentioned, like as we learn ABCD and with
Big,
time we are
this
fine.
big book.
So with that book, you will be able to understand a lot better.
Yeah.
So
Good.
there is nothing in Ayurveda. Dosha is this. This is dosha. This is prakriti. It's not given. It's given if these properties are changed, that means vata is high. So with time, with learning, we will learn, okay, this is how the dosha is. This is how Dadu's works. And
Yeah.
so that's why most people have that confusion in the first stage. What
Mm-hmm.
is this? What is that? With the modern knowledge in our mind also confuses us a lot.
Definitely. Yeah. Well, thank you so much, Ashwara. This has been a wonderful conversation. It has given me so many nice meta analogies that you have brought in, the upside down, a person being upside down, and one more that I'm missing right now, and a lot of new concepts and understanding knowledge. It's not often that we talk about, the physical health within the mental aspects
Mhm.
of life, but Ayurveda truly combines all those, on different levels. It does not leave out that, okay, if it's happening in the body, it's just limited to the body. It talks about psychological impact, cognitive impact, emotional impact, and the physical impact, which
Yes,
is
that's
something.
why there was no need to give these much symptoms in a disease of piles, right? So
Uh-huh,
they
exactly.
have given that symptom means they even have thought about that much. They have seen that many patients with the same issue, so that they did that trial and error and research
Yeah.
in that time, and they combined everything that what they have learned and given to us.
Yeah, that's truly what's an integrative and holistic treatment, right? because we're not disregarding the person's mental state and the impact that it can have in a disease or an imbalance, or even the context. If we talk about uh, house homemaker women, so they will have different emotional aspects going on because living with in-laws and adjusting and this, that, the other, and how that plays and manifests in their body to present as overt symptoms, but it has roots in those emotional adjustment shifts. So I love that about Ayurveda. I've always respected that about Ayurveda. And I feel very connected to the science overall, very, very connected, more so because they have given so much attention to women. In modern science, I have noticed now the attention is coming to research on women's issues, but earlier it was so male dominated, the symptoms, how they present. But Ayurveda is already holistic. They talk about women, their issues, everything
Everything,
encapsulated. Yeah.
everything, almost everything. If you look to those things, everything they have mentioned. So there is
Yeah.
one thing that I have heard is, I think one of my senior doctor told to me. So if you say something in Ayurvedic terms, in our own terms, to us, even I come like that. If I change my doctor aspect, somebody say good thing, some ancient thing, we have that what tendency to not accept it at first. But if
Uh-huh.
they come as an English term or something from
Oh, the elitist connotation, it's very
outside
real.
India, so intermittent fasting became very popular when it
Yeah.
has that term. Okay.
Yeah.
But before that, we were doing the same thing. We were eating, having an early dinner, and then we have in the morning. So almost that 12 to 16 hours gap was there. After
Yeah.
that, nobody eat. It was like that. But if they say some, I'm not uh, saying it's bad or anything, but
But
if
it's
they
true,
give something,
Aishwarya. It's
it's
really true.
actually
The
true.
Western influence is so high that the moment, now we're accepting yoga and this. Why? Because it
Yes.
went from India to the West, and then now
Best.
it's coming
Coming
back
back to
from
India.
there. Yeah.
Yeah, some doctor gave me a word. It's like some, I don't remember that much. It's like a syndrome or something. It's like that. If they comes back to us, oh, we will be happy. We'll be, yes, I'm doing
Yeah.
that. We'll be so proud I'm doing this.
It's more
But
of a
if we,
prestigious elite thing that we're doing, which is
yes,
modern and westernized. But yeah, I really, that is why one of, in the starting of a conversation, you said how you relate and understand more to your mother tongue, which is Malayalam. And you said that I
yeah,
must be relating more to Hindi. I was, I was actually quite taken aback because I'm like, I do not. That's why I have born and brought up in Delhi, UP, like, capital city and all. City where everyone said that speaking English is the better, bigger thing to do. And
hmm,
Hindi was not appreciated as much. Like Hindi mein koi bol raha hai, like whatever. But if you speak in English, suddenly everyone is listening to you, right? So it's more of a prestigious thing that comes in. But now I'm slowly understanding and I'm connecting more to my roots by understanding Ayurveda, yoga, and even I want to now pick up books in Hindi text. So if I don't read that well, it's okay. I can develop that skill again,
yes,
right?
yeah,
So it's more about what is going back to my roots. That's the main theme for me these days. Be it if it comes with the prestigious or elite look of being westernized or not, it is what gives me stability. Yeah.
yeah. Okay.
Okay. So thank you so much for coming in today. It's like I said, it's been genuinely a pleasure. You have added a lot of value to my life just by having this conversation. So, and thank you for contributing. I know you're doing your Gurukulam, you're doing your hospital work, you're doing your private practice, you're making content. So I genuinely feel very honored that you spent so much time talking to me here today.
Thank you so much. Actually, you would have noticed I was like very anxious before we started recording, and still at the starting of our recording, also I
Yeah.
was thinking like, what am I gonna say? What? I was not actually prepared anything.
Mm-hmm.
Because I came back early from the work, and like we had fixed our timings, right?
Yeah.
So with you, with every questions you were helped me so much, so that it's not like I learned this or that I'm gonna
Yeah.
speak, but you asked me so that whatever was inside me came out.
Yeah, and I honestly, if without preparing, you can offer so much. It talks volumes about the depth of knowledge that you have. And this too, we had to cut it short. It's not like we covered everything.
No, we didn't. Even the topic that we started, we were not able to complete it properly, and then going on and gone.
Yeah, yeah. So it calls for another conversation someday. I'm very happy anyway.
Sure, sure. Thank you.
Perfect. So as we're closing this off, can you tell the listeners what services you're providing right now and how can they reach out to you?
Okay, so right now it's through Instagram in my handle Ayurvedic Healing, and I can also give them my number.
Yeah.
Okay, it's 8921 743 288.
I will
So please,
mention this in the show notes also.
okay, so don't call me like that because I might be at work. Okay, so in this number you can also WhatsApp me, or you can connect me on Instagram in my handle. I think the link will be provided in the description. Okay, and I provide online consultation, also offline consultation. So if you're somebody in Thrissur, nearby my home, so you can connect me. So with the location, we can see if it's online or offline that works. And then I'm also selling a little bit of products also on Instagram. So I think if you check the handle, you will be able to see.
My mother is using one of the hair oils that you make, and she's been loving that.
Yeah, she ordered the second bottle.
Oh, amazing.
I dispatched it. I dispatched it, I
Amazing.
think, days before.
Yeah. I personally loved that you provide 1 hour consultations to actually understand a person's entire experience physically, mentally. And that, of course, you bring a nice energy to the conversations as well. It's not like, oh my God, now I have to go. It doesn't feel like I'm going to see a doctor, honestly, when I'm talking to you. It feels like I'm talking to a friend who's trying to understand me and who holds a lot of knowledge and will tell me what I can do differently.
Thank you so much. I think,
Oh,
yeah.
yeah.
That's how a doctor should be, I guess.
Yeah, for sure. I would not feel scared of going to a doctor if everyone's like you. Yeah, so thank you so much for being yourself, Aishwarya. Thank you so much for coming in here. And this
Thank
is
you
a
for
start to
inviting
a
me.
lot more conversations.
Sure, sure.
All right.
Okay, thank you.